Yeah, for you, Prefect.
Thank you, Honorable Speaker. I rise to second the motion.
Thank you very much. It has been moved and seconded that the record of votes and proceedings of the National Assembly sitting of Wednesday, the 23rd of September 2020 be considered and approved. Any corrections or observations, amendments from honorable members, starting with page 1. Thank you, yes. Kiang Central, page 1.
Thank you, ma'am. I want also to look at the cover page where you have Wednesday 24th instead of 23rd September 2020.
Please, table office, can we be taking notes of these things? They are minor, but they are very important. Any more observations on the front page? And page 1? Page 1? No. Page 2? Yes, Sabasanjal.
Thank you, Madam Speaker. I was not here yesterday, and I'm captured on the present list.
What number are you captured? Number?
Page 3.
Can you assist with the number, please?
It's page 3, 30, number 30.
Page 2, do we have anything on page 2? Any corrections on page 2? Okay, then we'll go to 3. Please, can you correct Honorable Member for Sabasanya? Thank you. Any more? The attendance? Page 4. Page 4. Page 5. Yes, Willie is.
Yes, page 5. Let's be consistent. In the first paragraph, we always say to be corrected and approved. But what we have there is considered and adopted.
Attention to that this morning, that is always considered first before approval. Thank you. On 5? Thank you. 6? Page 6? Page 7? Yes, Gara East. Page 7.
Thank you. Page 6. The last sentence before ensuing debates. Members to respect and observe the rules she has indicated. I think it will be the rules she indicated. That will suffice.
Any more? On 6, 7? Page 7? Page 8, honorable members, can we all be guided so that we will get our records straight. Look at our page 7 where it says, at this juncture, the Assembly could not sit beyond 6 p.m. and the Honorable Speaker put the question. I think what transpired was it was almost 6 o'clock, and I used clause 13 of the standing orders to adjourn the session yesterday. I stand to be corrected, but I think that was what happened. Yes, so I think this should be deleted where it says question put and agreed to. Just that the Assembly adjourned at 6 o'clock, the Speaker acting under clause 13, subclause 1. I think that it would be a true reflection of what transpired yesterday. Yes, Loanyomi?
Attention to the continuous question mark that is being applied. The question mark that is being applied, those not in favor, please say no question mark.
Claim that is inapplicable here because of the clause that was invoked yesterday. You will recall that there was no question put and answer because, thank you. Any more? Or any more observations, corrections, suggestions? Thank you very much. It has been moved and seconded that the record of votes and proceedings of the National Assembly sitting of Wednesday, the 23rd of September 2020 be approved with amendments. Those in favor, please say aye. Those not in favor, please say no. So the ayes have it. Clerk, can we proceed, please?
Matters of the day, in accordance with clause 51 of the standing orders.
Thank you very much. Honorable members will recall that yesterday, the honorable member for Central Badibu made a statement with regards to matters of the day. Now, under the relevant standing orders, I will allow 30 minutes for honorable members who may wish to make a statement in connection with the statement that was delivered yesterday. So may I allow honorable members, anybody who wishes to say something? Not more than 30 minutes, honorable members. I think it's even 3 minutes, yes. Kiang Central, thank you.
Thank you very much,
A
Mr.
copy
Speaker.
of the statement has already been circulated.
Yeah, forgive me the floor.
Thank you.
Really, if you look at the statement read by the honorable colleagues from Central Badibu concerning the issue that is the high rate of maternal death in this country is certainly a concern to everybody. Here is a problem. So I think what we need to do is to find a solution. Anytime you have a problem, you find a solution. What are the causes of maternal death in this country? We should look into it. If it is from the hospital, if it is from the persons concerned, what can we do? I think it's very, very important. In other areas, these are things that rarely occur, but there are there are factors that are responsible for it. I think now what we need to do is to sit down and look at the matter and then see what can we do to solve this problem once and for all. And I really thank him very much for coming up with such statement. Thank you very much.
Thank you very much, Honorable. Yes, Honorable Member, Jara East.
Thank you, Madam Speaker. I think the statement delivered by member for Central Badibu is both a celebration and a reflection for the Gambian women. Celebration in the sense that we need to celebrate our women, for they are very important in our life. Reflection in the sense that we need to reflect in terms of how to upgrade our health sector. Honorable Speaker, maternal mortality It's a very serious thing. And what this statement is telling us is for us to put our hands together, put our heads together, and combat it once and for all. And I hope this statement will send a positive signal for authorities to work very assiduously so as to stem it. Thank you very much.
Yes, Honorable Member for Banjul North.
Thank you very much, Honorable Speaker. Honorable Speaker, I want to salute the mover of the motion for bringing to the attention of the National Assembly a situation that is unacceptable. I think it's the duty of every country, governments, national assemblies, to ensure that no woman dies during childbirth, during pregnancy. It's a challenge, but it's a challenge that one can overcome. According to the records in the Gambia here, the situation is registering a decline. But even if it is one life, it matters. Every effort has to be made to ensure that maternal and child mortality is a thing of the past. Mothers deserve the attention that they require to go through their pregnancy and then end up in safe delivery with both the mother and the child being alive. That should be the quest of the government, the quest of the National Assembly, and the quest of those that are supposed to be rendering service, that are supposed to be attending women in both antenatal and postnatal conditions. Following there was an incident, I think, I'm not sure whether that is what had prompted the mover to come up with this motion, but there was an incident of a woman who went to a clinic, a private clinic, for delivery. She was there for some time. The matter had to be referred to the Edward Francis Small Teaching Hospital. And I understand that they went there, but the woman was refused attendance. They refused to attend to her. Well, the claim is that those workers at the hospital believe that the woman is a COVID positive. So she was referred back to the clinic. The claim still that they returned her to the clinic, but those at the clinic, after seeing her condition, referred her back again to Banjul, and she was still refused. I think it was on the way back, the second leg, that she passed away. But these are all claims, and I understand, as a member of the Select Committee on Health and the chair, I was engaged by an official. I think the minister would come and explain that further, that efforts are being made to inquire about that situation. But I think the executive, the minister, is in a better position to explain that situation. But it is really regrettable, and we should ensure that if that was the case, it is not repeated. It is very disheartening. As I said, every human being passed through that stage. And if we, or those that give birth to us, had passed through that situation.
Honorable, I should have indicated that your minimum time is 3 minutes.
3 minutes.
No, but
okay.
you just wrap up.
Okay, I'm wrapping up, yes. I just
an
want to
extra
say that,
minute
yes,
to
okay.
wrap up, yes.
Okay, thank you, Honorable Speaker.
I know, because you are the chair of the Health Committee.
That's
the reason why I'm giving you an extra 1 minute to wrap up. Thank you.
Thank you for the generosity. Yes, so as I said, if those that are alive had passed through that situation, you would not have been alive. So we have to really do justice to women and the prospective babies that are going to, be given birth to. So it's a move in the right direction, which everybody should support. And I think the executive and the legislature, and also those at the level of the facilities, would take heed and ensure that maternal and child mortality is really a thing of the past. Thank you very much.
Member for Yamina East, 3 minutes.
Thank you very much, Honorable Speaker. Honorable Speaker, I think the women of this country, of course, they have given us a clarion call. A call by saying there is a situation, there is an outstanding issue that we need to address. And for us to address that issue, of course, Honorable Speaker, they mean the maternal mortality death rate is seriously increasing, and it is very alarming. So obviously the executive must conspire with the legislature and of course with the judiciary to see how best we can fix this problem, because it is known to everyone. And the women, of course, they have given us this clarion call. It is about time we see how best we can start mobilizing resources, but starting from our own resources to ensure that this problem, it is fixed, so that our women and the Gambian people at large, they have that quality health service delivery. Thank you.
Yes, Sani Mentereng.
Thank you very much, Ma, for giving me the floor. I think this issue at hand, we should start it at home. Why did I say that? Because some of us women, when we pregnate our women, we never give them good food, because forgetting that this woman is feeding another child inside, we never give them good food. All what we think of is the naming ceremony. We accumulate money, we never give them good food to eat. And the other thing is, Ma, how many women will deliver that would need blood? Because during their pregnancy, they face malnutrition. So let us go over this and see, and start everything at home to make sure that when your wife is pregnant, you give her good food, because she is feeding herself and feeding another child. Thank you very much.
Ilyasa, did I see your tag?
Thank you very much, Madam. My point, maybe observation, I stand to be corrected, and I think this is a very important matter, and I look at the other paper, I don't see it captured there. And in the concluding remark of the mover, he moved a motion for the minister to come and make some clarification on this issue. And I don't think these are reflected in the other paper. I think it's very important. Some of the things are captured. However, the issue, as the honorable member for Banjul North has said, statistics, we are not sure of the statistics, but what we are hearing is that the rate is somehow declining. However, even if it is one single life, it's very important. I think it should be a collective effort for all of us to see how we can cope these menace, because you cannot just point hand to anybody as a person responsible for this situation. Men, women, and even the health workers, everybody is responsible. But I am really sad to hear when he said somebody is COVID positive, the doctors distanced themselves from her. That has led to the cause of his death, her death. That's the claim. So I think that is very sad, and definitely we should regret to have such situation any longer. Thank you very much, Mr. for giving the job.
I think you're quite right. It ought to have been reflected on the other paper. But you will appreciate the fact that the other paper was rushed this morning. It was earlier on circulated, but had to be withdrawn because of certain administrative rearrangements here and there. So we apologize. But I think it's equally important that we allow honorable members to have a say on this very important issue. Thank you. Any more? We still have time. 30 minutes is allocated. We have about 15 to 20 minutes more. So anybody who wishes to say something, Busumbala, 3 minutes. Well, I asked you, Ilyasa, and you said no.
Madam Speaker, thank you very much.
Busumbala, please, thank you.
Yes, thank you very much. I think I'll be very brief. Madam Speaker, there is something that is on the table of every Gambian which requires no blame game. If you look at, I think I'm a victim, and I know something about it because recently my wife delivers at LVTH. I've seen the tireless effort that the health workers were doing. They've done their best in whatever, but if unfortunate circumstances happen, it is a collective responsibility for all of us to come and do a research on it. But I also want to ask the Ministry of Health that it is their domain to do a research and come with a conclusive statement what might lead to this, because I think this one is a branch that is connected to one stem. As my colleague said, it could be a problem from home, it could be anywhere. So the Ministry of Health need to have an assessment or a research on this so that such things might never be an alarm for the whole country. So Madam Speaker, this is my advice. Thank you.
Honorable Member for Ilyasa.
Okay. Well, thank you very much, Madam Speaker. And I congratulate the mover. But Madam Speaker, and if you want to say the facts, the nurses need to be trained, and they need to be, and they start to give respect to the patients. Because Madam Speaker, I was from this just last week. The way the certain nurses are approaching people definitely is very bad. The Ministry of Health should try to sensitize the nurses and train them so that they can just respect the patients as well as their mothers. Because I was just passing by, found the hospital, even at the delivery center. The comment I have from certain nurses, definitely that's not even human. But they need to be trained so that they'll be able to do their work as they should do. Thank you very much.
Yes, yes, Serakunda. Yes, and then Serakunda and then Basse.
Thank you very much, Honorable Speaker. Honorable Speaker, the statement I see before me is not indicting any individual. The statement clearly stipulates a condition that lives of mothers are threatened. Lives of pregnant women are threatened. And those lives matter. That's what we are told. Honorable Speaker, wherever we see maternal mortality, then the whole future of a society is put into jeopardy. The foundation of human life is the womb of the woman. And that woman needs protection in order for future generations to be protected. Women and infants are connected, and they are the link to the future. So any society that wants to survive, any society that treasures its existence must treasure its mothers and children. That's precisely what this statement is alerting us to put our minds to. And that's what we should do, and I'm sure, listening to all the members, we are concerned. A motion was allegedly made, I may say allegedly made, because a motion would have to be seconded to be a motion to be debated. But the standing orders tells us very clearly on the 51(9) that no member may intervene during a member statement under the standing order, and there shall be no questions and no vote shall be taken on at the conclusion of the statement, at the conclusion of the statement or statements. So this particular standing order is not designed for motions of that nature. It's designed to put the issue of the day to the fore for our discussion. And thereafter, the member may independently come up with a motion of that nature. And I'm sure 53 would be able to, with your permission, come up with a motion that would be accepted in that regard. Thank you very much, Honorable Speaker.
I think the standing orders are very clear, and this is not the first time that a statement touching on matters of the day is being tabled before this Honorable Assembly. We still have about 6-7 more minutes. Yes, Basse, sorry, Basse. Yes.
Madam Speaker, thank you for the
3 minutes.
There's an expression in French, which I may not allow to say it here, but anyway, the meaning is just be proud of yourself, the member of Central Badibu, because this is our responsibility to know the concerns of our people and to bring it to the attention of members, so that at the end of the day, anything has to come here and anything has to be decided here. So bringing our attention to this situation of sadness, at a moment where +1 - 1 occur at the same time, is definitely a situation of concern of everybody. The challenges might be many, but starting by ourselves, especially in the family, late report is always a challenge. They don't report early. If they conceive, they don't report early. That's a challenge. And that challenge, we have to cooperate with them in order to help them so that the moment they conceive, let them report early. And the second challenge is blood bank. And I think we all bear witness that our member for Woodley West, he is not here, but anytime if he intervenes, normally this is his concern, blood banks. Every health center should have a blood bank. And I think the question, your last, at your conclusion, you wanted the minister to give us the statistics. So I don't know at this point if you can submit yourself and your statement to the Select Committee of Health so that to go deep into this issue, get necessary information, and to work on the way forward. So on that note, I want to thank you once again and be proud of yourself. Thank you, Madam Speaker.
Yeah, you have a minute. Okay. My majority leader.
Thank you very
Members,
much.
but before you proceed, may I just appeal? We've just received an appeal from the Hansard Department that because of the masks, they are not getting the voices clearly for record purposes. So that if we can all speak a little bit loud, so that they will capture everything. Yes, thank you.
Thank you very much, Honorable Speaker. Let me begin by thanking the member for Central Badibu to coming up with this statement. I think, as alluded to by my previous colleagues, it's important that we build and solidify this foundation. Infant mortality, as alluded to, is on the increase, and consistently for the past few days, a lot had happened in this country. And I think that's what had prompted the statement from the member for Central Badibu. And our concerns had been raised across the country where women and all their partners have been talking about the importance of the life of the Gambian women. Few issues have just been coming, and I think those things need to be consolidated. What we need to do, and I think it is important at the level of the ministry, to expand the public health promotion education programs across the length and breadth of this country, so that all the steps that need to be taken are done at the right time and ensure that the people are more informed and educated to ensure that we do not have all these things too. And I think it is also important, these two agencies are also important. They need to expand on the research work that they are doing at the ministry. So if we have these two things, these two units pumped up and also expanded, so that will enable us to ensure that the trend that we are doing, whether we are doing bad or we are doing good, and what do we do to ensure that the information gets to the people. So generally, and I think the health committee, that's an area that we need to take up with the ministry to make sure that we work on those lines and then to ensure that these things don't happen again. Thank you, Honorable Speaker.
Thank you very much. Any more? I think we have more than, yeah, that's it. I think we can close it at that. Honorable members, as rightly indicated and earlier on stated, of course, clause 51 is very clear. Subclause 9 says no member may intervene during a member statement under this standing order, and there shall be no questions and no vote shall be taken at the conclusion of the statement or statements. So that is where we are. But I also have clause 24, which I want to read out for members to take note of. 25(2). It says the assembly shall allow time for the vice president or a minister to speak whenever any bill or other matter concerning a department or other business of government committed to his or her charge is debated. I understand there is no debate, but issues have been raised, and we fortunately have the Honorable Minister here, and being such an important matter, I think that it's only reasonable for clarification purposes to call the Honorable Minister of Health to maybe clarify some issues. But that notwithstanding, they are working together with the Office of the Clerk, that is the Directorate of Health, to prepare a comprehensive statement that will be circulated to honorable members to get a better understanding, and maybe the health committee can use that statement and engage the directorate so that the matter can be further discussed. So I think we can use this clause to allow the Honorable Minister of Health to respond. Honorable Minister, please. Thank you. Can we, I've already,
Thank you very much. Well, Honorable Speaker, you're fine. Okay. Okay, what I was just going to refer to, because I just saw the Honorable Minister of Health just coming into the chambers after we've already spoken about the issue. So I'm not sure if somebody has the issues that were raised that can be given to him so that he can respond accurately. Yeah.
Issues, thank you. I'm not holding anybody's brief, but the Deputy Director or the Director of Health Services is here, and they have been here, and they've been given a copy of the statement. Maybe you were not here yesterday. The statement was read out yesterday. Nyamina East? Okay, thank you. So that we'll all, but a comprehensive statement, as I said, will be provided. Thank you.
Good morning. Madam Speaker, distinguished honorable members, maternal mortality is a very important and heart-touching issue in the Gambia and all other countries of the world. Maternal mortality is defined as the death of a woman who is pregnant or within 42 days of termination of pregnancy, irrespective of the duration and outcome of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Excuse me. The death of a mother who is always a woman in her prime is always a sad end to a period that should be a joyous one in the welcoming of a new member of the family. It brings sadness to the family and the world that bears a child without a mother. Humanity is cognizant of this fact, and the government of the Gambia is very concerned, as always, with the death of any single person, especially a mother in this country. Maternal mortality is a complex issue that is caused by many factors. It is, however, thought to be preventable in up to 80% of the cases. Madam Speaker, distinguished National Assembly members, the main causes of maternal mortality in the Gambia are pregnancy-induced hypertension, 18%, hemorrhage, that's bleeding, 11%, anemia, 11%, sepsis, that's infection, 1%, and the remaining are due to other causes, including indirect causes such as diabetes in pregnancy, heart failure, etc. Madam Speaker, distinguished National Assembly members, it is important to note that in this country, maternal mortality has been on the decline, notwithstanding the perception of the rise in maternal mortality. It is important to emphasize that it is actually on the decline based on what had been happening in the previous years. The figures below corroborate these findings. In 2013, according to the Demographic Health Survey, there were 433 maternal deaths per 100,000 live births. Now, when you go to 2014, it was 208. 2015, 250 per 100,000 live births. 2016, 195. 2017, 236. 2018, 283 per 100,000 live births. 2019, 221 per 100,000 live births. And as we speak, based on the figures already gathered up to September this year, doing the calculations, it is 169 per 100,000 live births. So we can see the declining trend. Now, comparing with what happens in other countries, this is by no way trying to justify that any maternal mortality is justifiable. But it is very important to also know what prevails elsewhere so that we put forward a basis for comparison. In Cuba, they have 36 per 100,000 live births for 2017 figures. In the USA, they have 19. In Spain, they have only 4 per 100,000 live births. In the United Kingdom, they have 7. In Nigeria, they have 917 per 100,000 live births. In Mali, they have 562 per 100,000 live births. In Sierra Leone, they have 1,360 per 100,000 live births. In Guinea-Bissau, 667 per 100,000 live births. Liberia, 661 per 100,000 live births. Senegal, 315. And in the Gambia, our last DHS survey, as I mentioned earlier, indicated the figure at 433, but on the analysis of what we have today, it is 169 per 100,000 live births. So comparatively, Gambia is not doing so badly compared to other countries. But when it comes to human life, everyone is important. So our wish is to bring it to 0. These figures show that Gambia has been able to reduce maternal mortality from 433 per 100,000 live births in 2013 to the current state, which is 169 per 100,000 live births. Yes, our wish is to reduce it to 0, but we must say there has been a lot of improvement. Yes, sometimes the attitude of few health workers contributes to the events. We've heard of incidences of delayed response of the health worker. inavailability of what is required to provide the services in certain instances, and sometimes few cases of insensitivity on the side of the health workers. And those are all not justifiable, and anytime we hear of such, we investigate, and currently we are investigating a few. However, it is important at this juncture to note that the majority of the cases of maternal mortality have multiple causes. In so saying, maternal mortality is a complex issue that has multiple causes. One of them is late or irregular antenatal attendance. In some cases, is responsible for the late detection of possible complications that could have been avoided. 2, malnutrition in pregnancy. Many of our people, especially in the provinces, even before they get pregnant, and even in the urban settings, are malnourished, and this is worsened in pregnancy. This has been found to lead to anemia in pregnancy, which is one of the leading causes of maternal mortality. Some health facilities are not adequately equipped to detect some of the early signs of the complications of pregnancy. Number 4, delay in getting to the facilities for delivery has been responsible for some of the patients having irreversible complications when they are at the health facilities. Their delays could be caused by poor road networks in some areas, absence of proper means of transportation in some cases. Some women do not have enough funds to hire a taxi to get to a health facility. We have heard of a sad instance where a gentleman who worked in Banjul was called that the woman was in labor somewhere in Combo South, and he said to the woman, "Wait for me, I'm coming." He entered the traffic, took about 2 hours to get home because the woman couldn't go by herself. He got home, they looked for a taxi, which was difficult to get. By the time they got to the hospital, it was too late, and that woman passed away. So these are some of the realities of life. Inavailability of blood for transfusion and taboos surrounding blood donations in some communities. It is sad to note that most of the times our blood banks do not have blood ready for use because we have quite a lot of very generous donors, but the majority of Gambians are not willing to donate blood. We only have relative donors, those whose relative is sick and they go to donate. Otherwise, we do not have people willingly in large numbers going to donate blood. There are taboos surrounding that. We had an instance somewhere of country where a gentleman, the wife was in need of blood, and the husband's mother said the son, that's the woman's husband, was not going to donate because it was going to lead to him becoming impotent. And the woman was left like that. Unfortunately, she passed away. The other issue about blood donation that has been a big challenge is the fear of people being tested. Because when people donate blood, they have to be tested for hepatitis. They have to be tested for HIV. So because of not wanting to be tested, people do not donate blood. And that is responsible for a host of maternal mortality cases. Many of these women could have been saved if they have blood in a timely fashion in an adequate quantity. Quite a lot of them die because they do not have blood, and blood can never be bought. What government can do is to encourage people to donate. We give blood substitutes, but blood can only be donated. Malpractice in certain private facilities has been responsible for maternal mortality in this country. It may surprise you to know that there has not been a registration or licensing system in place for private clinics in this country for more than 20 years. But we want to inform you that this is about to change soon as we put in guidelines that will be upheld after going through the due process. The implication is that some private clinics carry out whatever they want to carry out without guidelines, without monitoring, without even being licensed to do so. And that has detrimental effect on the lives of people. Now, too often than not, many of the patients are kept in the private facilities until most of their money is finished. That's when they are referred to the public health facilities when they're about to die. And then they come, and now the blame goes to the public health facilities. Now, we have heard of situations whereby staff in private facilities go look at a patient and say, oh, we better refer this patient. We don't want her to die here. You must refer immediately, because when the person dies in a private facility, it will give them a bad name. Hopefully that will stop soon, because we have started working and the modalities are in place. But also this reminds us of the need for support from the entire population. Some time ago, there was a case of maternal mortality in a private facility somewhere in Serekunda. We closed it down to investigate and to put down remedial strategies. Before we knew it, they went around, mobilized pregnant women who stormed our office to insist that we open that private facility. We had a long meeting with them to tell them that those steps were taken for their own good to save their lives. It is also sad to know that quite some maternal mortality in this country has been due to the action of crude abortionists. We still have people here who are incompetent. Some are not medical staff, and women go to them, unknown to them, and procure abortion services. The most recent one that is being investigated is a young lady who has a pacemaker in the heart, who got pregnant, went to this gentleman, and he used crude instruments into the woman, and then perforated the uterus, and leading to sepsis, severe infection, and that woman passed away after being referred to the referral hospital. The 8th point is inadequate manpower. The Gambia, being a low-income country, has serious manpower challenges. The number of doctors in high-income countries, the average is 2.9 doctors per 1,000 population. For low-income countries, it has been put to 0.3 per 1,000, being acceptable considering the circumstances. However, the recommended is 1 doctor rather. The recommended is 1 doctor per 1,000 population. In Gambia currently, we have 0.18 doctor per 1,000 population. So already there is a big manpower gap. When it comes to nurses and midwives, high-income countries, 7.1 nurse per 1,000 population. For low-income countries, 4 per 1,000. Gambia currently, we have only 1.5 per 1,000 population. So this shows that already we have a big gap, and it is these people who are supposed to provide services to our people. Many Gambian healthcare professionals in the diaspora whose absence in the country, even though many were trained here, has a big impact on the healthcare manpower needs of our country. Honorable members, we equally appeal to you to get in touch with them, because many of them, some of them very active, supporting behind the scenes, some of them rather more active with their mouths, giving positive criticisms, but quite a number with their mouths giving negative criticisms. But I think we should all appeal to them to come back and join our people to provide the services our people need, because they are contributing to reducing maternal mortality in other people's countries, whilst our people suffer here. The salaries are poor, we are all struggling, but we decided to stay put to provide those services for our people that they deserve. So I think it is high time we also reverse that trend of the flight of human capital the flight of knowledgeable people who are providing services elsewhere whilst our people suffer here. So, Madam Speaker, honorable members, if all our people decide to come back and join us here in our efforts against maternal mortality, within 6 months, we will see the impact we will make together. As a government, our strategies in tackling maternal mortality include, but not limited to, the following: awareness creation and sensitization. This is where we need the assistance of the public and all concerned citizens here in the country and abroad. It is good to protest for lives lost, but more importantly, to play a role in stopping the next maternal mortality by calling on women to register early for antenatal care, or we donate blood to our nearest health facilities. It would be good during the protest to have a blood donation drive as well. Of course, we are all aware of the recent protest, and we see it in a good light in the sense that it has helped to create awareness. Many people probably didn't know about the issues of maternal mortality, but I think it is in good light, and we are ready to work with them to forge ahead. Social and economic empowerment is very important. There is a strong correlation between the society's general socioeconomic advancement and maternal mortality. In societies where where the socioeconomic advancement is high, there is a lower level of maternal mortalities. People who are empowered socially and economically generally are able to make timely choices when it comes to pregnancy and labor. They are also less likely to enter pregnancy in a suboptimal level. They are also more likely to prepare for pregnancy, that is the preconception period. The ministry has initiated the Kabila-Obama initiative to empower women and educate them on reproductive and maternal health. This has been a success story that other countries are emulating. We have done it in a region in the Gambia where it has yielded very positive results, and we've gotten funding to expand it to the entire country. In the Kabila-Obama initiative, women and their spouses work together through the pregnancy. The men accompany their wives to the antenatal care. They remind them, they donate blood, they support them, they look at the symptoms and signs that would have been taught to all of them as a family, and it has yielded results. And we started seeing a decline in the maternal mortality in that region where the Kabila-Obama initiative has been very functional, and we are expanding that initiative. We've also started to renovate old and dilapidated facilities and also building new ones. The results-based program has brought about a revolution in the way the health facilities are being run, and we are maintaining the gains and hope to improve on it so the whole country is included. In this program, women are even given incentives for coming to attend antenatal care. So when they know they get to the facilities, they are given some financial incentives and some feeding supplements so that they continue to come, and it has been very helpful. Next year, we have plans to upgrade 14 facilities to be able to provide comprehensive obstetric and neonatal care. This will entail the construction of a theater and blood transfusion services so that we decentralize the conduction of cesarean section in the whole country so that women do not have to be transported for hundreds of kilometers to a facility where they can have cesarean section. That process has started. One example is Esau here. Esau is being renovated currently at the tune of over $9 million, and the theater is being improved upon, and already the doctors are there and cesarean sections will be done there for that part of the country so that they do not have to wait for a ferry to come to Banjul to get a cesarean section done. We are about to start, we are about to advertise for the construction of 11 health posts across the length and breadth of the country to make maternal care, especially antenatal care, accessible to more of our people. We hope to improve on the delay experienced by women in reaching facilities. We have already procured 10 ambulances, you are all aware, for the COVID response, and 23 are being processed for procurement. The idea is, and was before COVID, to start what we call maternal mortality reduction services, whereby we have community ambulances. The idea is to have these community ambulances stationed at strategic locations with a specific number, whereby anybody with a pregnant woman who needs to get to the hospital will call that number. The ambulance will go to the house of that person to pick and ferry straight to the hospital. For the provincial villages, it will be stationed in a health facility centrally located, and it will be available just for that service of picking people from their homes to the health facilities. We have realized that this has been a big challenge. The ambulances generally placed at the facilities are for conveyance of the patients from one facility to a referral site. They do not go to the homes to pick these women up. And this is the new thing we are going to start with these new ambulances, so that patients are picked from their homes to the facilities. Because we have had instances that a pregnant woman delivered on the way. That's not recent. A few years ago we had delivered on the way on a donkey cart. And the traditional birth attendant who was helping her out, it was a distressful situation because the woman delivered and they couldn't reach the health facility because it was at night and wolves decided to attack them. And then, so they had to run back. So these are the realities. So now we're going to get ambulance services to pick these women from their homes very soon, inshallah. We also said, as earlier mentioned, blood cannot be created, but must be donated. At this juncture, we thank all the blood donors in this country, especially the armed forces who have been very, very willing donors. We would request for all other institutions to emulate this gesture. That will help to save many lives. We've also, as mentioned earlier, started a process of licensing the private facilities that will be allowed only to carry out specific functions that they are competent enough to do. Because unfortunately, almost all private facilities here are jacks of all trade. They do whatever they want to do without caution, without restriction, and unfortunately as well, we have also had instances whereby some facilities, because they want to conduct a cesarean section in that private facility, they refuse to refer a patient, because when people conduct cesarean section, they are paid more in their facility. So these patients are refused referral early on because the wish is to conduct a cesarean section here. And sometime last year, that was the result, the cause of losing a young 32-year-old woman who should have been referred 2 weeks or so earlier, but was kept in one facility. For those doing unsafe abortions, we continue to notify the police, and then we also urge everyone to help us in maintaining vigilance, and we discourage the people because it is illegal in the first place, but rather than that, it is dangerous, and it could cause the loss of life. We also hope to reduce maternal mortality by the commencement of specialization training of doctors and nurses in the Gambia. It has been started already for the first time in this country in the areas of obstetrics and gynecology and general surgery. Madam Speaker, distinguished National Assembly members, we are now training gynecologists and obstetricians in this country, and we thank you all for that support, because some time ago, our people came here requesting for extra funding to be able to bring in more specialists from across the world to strengthen our postgraduate trainings here. And you all debated over it, and we were given that support. We thank you all, and we thank our House Health Select Committee who have been at the forefront of that. The process has already started. Unfortunately, there were some delays in expanding because of the COVID crisis that has prevented people from coming from other countries into the Gambia, but the process will continue. Madam Speaker, distinguished National Assembly members, maternal mortality, as you can see from this submission, is a very complex issue. The healthcare workers have an important role to play when the patient gets to them. And it is not excusable for anybody to be found wanting, to be negligent. And at this juncture, I wish to apologize to the entire nation, more so to the families of those who have been affected by the negligence of any healthcare worker. We wish to say we are very sorry, and we will do our best to make sure that that does not happen again. Any one of them who is also found wanting, it will be investigated. We currently have a few that have been investigated by the relevant authorities, and the necessary actions will be taken, because there shouldn't be any compromise when it comes to the lives of people. However, at this juncture, it is also very important for us to understand the complexity of the issues surrounding maternal mortality, from poverty, from malnutrition, to bad roads, to knowledge about when to seek care, about who even accompanies the person to the hospital. Quite a number of our women are accompanied by an elderly woman from the community, who usually is unable to detect anything on the way or even help to poor transport mechanisms. So it is a very complex issue. Of course, our health facilities themselves need to be improved upon. We did mention maternal mortality in Spain being 4 per 100,000 live births. A small region in Spain of about 2 million people, just like the Gambia, their health budget is 1.9 billion euros. Certainly, it will be very difficult to compare the outcome of patient management in that region to a resource-poor Gambia. Of course, it is important that we do our best, but resource limitations certainly also have an important role in maternal mortality. At this juncture, Madam Speaker, distinguished honorable members, we wish to thank you all for your interest and giving us the opportunity to make this clarification. It has been a very difficult thing. It is heartbreaking for all of us. All of us feel the pinch, because these are our sisters, our mothers, our wives. They are part of us. So we all feel the pinch. We are all concerned. We are all equally stressed out when it happens. But I think collectively, we can make a difference. But we want you to help us in the continuous advocacy as you did for COVID. I think we should equally do for maternal mortality. Our people are developing TV jingles. Some are already on. radio drama shows, and posters, and would like to share those with you so that it reaches the communities. But the advocacy is very important, because the more they know, the less likely they are to fall victim to the issue of maternal mortality. Once again, I use the opportunity to thank you for your kind attention.
Thank you very much. Thank you very much, Honorable Minister. And I'm sure the Directorate will continue working with the Office of the Clerk so that the Health Committee can start work immediately. On that note, may I call on the Clerk for us to proceed with the bill, please? Thank you.
Bill, Standing Order 72, Sub 20 and 75, third reading of the bill. The Gambia Women Enterprise Fund Bill 2020 by the Honorable Minister for Women and Social Welfare.
Thank you very much. Honorable members will recall that the third reading of the Gambia Women Enterprise Fund Bill 2020 was scheduled for Monday, the 21st of September 2020. However, it was realized that the reprinted version of the bill did not capture all the amendments made at the consideration stage. Therefore, it was resolved to defer the third reading until such time that the person in charge of the bill submits the corrected version of the bill. Accordingly, the reprinted version of the bill entitled the Gambia Women's Enterprise Fund Bill 2020 is now before us for consideration. And I will therefore invite the Honorable Minister for Women, Children and Social Welfare to move a motion for the third reading of the bill entitled the Gambia Women Enterprise Fund Bill 2020. But before doing so, I would just want to confirm from the chair whether everything has been captured adequately. Because
Yes, thank you very much, Honorable Speaker. From the co-chair, because we have two co-chairs, yes, okay. Yes, okay. On behalf of the Joint Committee, I wish to inform the Assembly that we have been working, consulting with the Ministry, and they too have been, they told us that they also have been consulting with the Council at the Ministry of Justice to ensure that all the corrections are factored. So I can confirm that they have been factored. They are factored in this final document before us. Thank you.
Honorable Minister, you can move the motion. Thank you. You have copies of the bill, everybody. Yes, thank you.
Honorable Speaker, honorable members of the National Assembly here present, I also wish to acknowledge the Vice President and honorable ministers and members of the National Women's Council here present. Following the successful first and second readings of the Women Enterprise Fund Bill 2020 and the subsequent amendments, I beg to move that the bill entitled Women Enterprise Fund Bill 2020 be read a third time for approval and enactment by this August Assembly. Thank you very much.
Thank you. Any seconder? Yes, Honorable nominated member, Seka. Thank you.
Thank you very much, Ma. I humbly second the motion that that the bill entitled Women Enterprise Fund is to be to be approved. I humbly move, second that motion.
Honorable members, it has been moved and seconded that the bill entitled the Gambia Women Enterprise Fund Bill 2020, having gone through the consideration stage with amendments, be read a third time and passed. Those in favor, please say aye. Aye. Those not in favor, please say no. So the ayes have it. Clerk, can you please read the short title? Thank you.
The Gambia Women Enterprise Fund Bill 2020.
Thank you very much, Honorable Minister. Thank you very much, and all honorable members, of course, including the committee members, the joint committee members. Thank you. Clerk, can we proceed on the motions? We deal with the motions without notice first. Yeah. Thank you.
Motions without notice in pursuant to clause 53R of and 66(4) of the standing orders.
Thank you very much. The ABC had approved the consideration of the motions without notice. So any honorable member? Honorable members who wish to move a motion without notice, otherwise we will proceed. Yes, Opasalu. Sorry. Well, I have been called.
Thank you very much, Honorable Speaker. I rise to move a motion for the extension of the committee stage on the bill, Anti-Corruption Bill 2019, relying on our standing orders, clause 53I and 66, subclause 4, to the fourth ordinary session. That's the Anti-Corruption Bill 2019.
Yes, Jara Central.
I write to second the motion, Ma.
Thank you very much. It has been moved and seconded that the committee stage of the bill entitled Gambia Anti-Corruption Bill 2020 be extended until the fourth ordinary session of the Assembly. Those in favor, please say aye. Aye. Those not in favor, please say no. So the ayes have it. The committee stage of the Gambia Anti-Corruption Bill 2020 is hereby extended until the fourth ordinary session of the Assembly. Honorable Member for Woolly East. Sorry, I'll come one back.
Thank you. Honorable Speaker, in accordance with clause 53(1) and 66(4) of the standing orders, I rise to move that the committee stage of the undermentioned bills be extended until the fourth ordinary session of the Assembly. 1. Persons with Disabilities Bill 2020, Criminal Offences Bill 2020, Criminal Procedure Bill 2020, Prevention and Prohibition of Torture Bill 2020, and International Crimes Bill 2020. Thank you.
Seconder, yes, Combo East.
Thank you very much, Honorable Speaker. I rise to second the motion.
It has been moved and seconded that the committee stage of the undermentioned bills be extended until the fourth ordinary session of the Assembly. 1. Persons with Disabilities Bill 2020, Criminal Offences Bill 2020, Criminal Procedure Bill 2020, Prevention and Prohibition of Torture Bill 2020, and the International Crimes Bill of 2020. Those in favor, please say aye.
Aye.
Those not in favor, please say no. The ayes have it. The committee stage of the aforementioned bills are hereby extended until the fourth ordinary session of the Assembly. Upper Fuladu. Yes, thank you.
Thank you, Honorable Speaker. In accordance with clauses 53.1 and 66.4 of the standing orders, I rise to move that the bill entitled Tourism Offences Amendment Bill 2020 be expedited until the fourth ordinary session of the Assembly. Thank you.
Observation, Honorable Speaker, observation.
Yes.
The clause the member quoted, it should be 53I, not 53.1. 53I to be updated.
It's 53 R.
But I did not get the bill. Sorry, can you repeat your...
Sexual offense. Which bill?
Which bill are you?
Let me just repeat, Madam Speaker.
In sequence. But
Yes, so it's R.
when we fail to follow the sequence, I have to be turning the pages.
I understand. So, in accordance with clauses 53R of the and 66.4 of the standing orders, I rise to move that the bill entitled Tourism Offences Amendment Bill 2020 be expedited until the fourth ordinary session of the Assembly.
Kumana.
Thank you. I rise to second.
Thank you. Sorry. It has been moved and seconded that the committee stage of the bill entitled Tourism Offences Amendment Bill 2020 be extended until the fourth ordinary session of the Assembly. Those in favor, please say aye. Those in favor, please say aye. Those not in favor, please say no. Honorable members, I did indicate earlier on that the Hansard unit is having some problems getting the recordings right. The committee stage of tourism offense.
Madam Speaker, please. Well, hence the Hansard is having a problem for members, on the floor using the, face masks. Well, given why not allowing us to, when we are on the deliberation to use, without it? Because closing your mouth on something, you cannot, not everybody can shout like people like Madam Kochamuza. So obviously, give us the chance.
Honorable
Yes.
member, let us use. I am not denying. It's not a question of allowing. I mean, maybe it may be convenient for some, and some may prefer to take extra caution in terms of leaving it on. So the decision is entirely that of the honorable members. But I have been advised by the Honorable Minister of Health to advise honorable members to put on the masks, especially when speaking. So I am not imposing any obligation on anybody. Thank you. I was saying the committee stage of the Tourism Offences Amendment Bill 2020 is hereby extended till the fourth session of the National Assembly. Any more applications? Yes, Honorable Member for Banjul North. Sorry.
Honorable Speaker, in accordance with clause 53R and 66.4 of the standing orders, I rise to move that the committee stage of the undermentioned bills be extended until the fourth ordinary session of the Assembly. 1. Women's Amendment Bill 2020, Civil Marriages Amendment Bill 2020, Christian Marriages Amendment Bill 2020, Married Women's Property Amendment Bill 2020, Matrimonial Causes Amendment Bill 2020, Skin Bleaching Prohibition Repeal Bill 2020, the Gambia Nationality and Citizenship Amendment Bill 2020, Births, Deaths and Marriages Registration Amendment Bill 2020, and Domestic Violence Amendment Bill 2020.
Any seconder? Seconder, yes, nominated member Ndeyasin.
Thank you, Ma. I rise to second the motion. And in the same vein, I would like the disability bill to be a core committee, that is the health and the constitutional matters, constitution and human rights matters. Thank you.
I think the motion is very specific on these 9 bills, so the secondment should be on this bill. The disability bill has already been dealt with. Yes, it has already been dealt with by the chairperson, vice chair of the Human Rights and Constitutional Matters Committee.
Then can I move a motion that it also refers
no,
to
let's
the
complete this
committees?
motion first, Honorable. Let's finish the motion. Any seconder? Yeah, you seconded. Okay. Thank you very much. Honorable members.
Observation before you take the vote. Which one?
For the extension of the committee stage.
Madam, point of observation.
Please, somebody has asked a question. I have not responded, so he's asking for which bills?
It's talking about, before you ask for second, the confirmation of the process, we have a concern that I want you to be clear. About the skin bleaching, if you allow me, I stand to be corrected, but I believe the skin bleaching bill was thrown away at the second reading. No, I stand to be corrected because that's the belief I have, that at the second reading, it was thrown out.
That can be clarified later, but what we have on record as far as formal procedure is concerned is that the Honorable Chair has moved a motion for the extension of the committee stage of these, the above cited bills, the bills that he has already cited, to next session. So I'm sure now and against that time, they will confirm whether the skin bleaching prohibition repeal bill was actually thrown out or not. But the motion has been seconded by the honorable nominated member, so we need to complete the procedure. It has been moved and seconded that the committee stage of the undermentioned bills be extended till the 4th ordinary session of the Assembly. 1, Women's Amendment Bill 2020, Civil Marriages Amendment Bill 2020, Christian Marriages Amendment Bill 2020, Married Women's Property Amendment Bill 2020, Matrimonial Causes Amendment Bill 2020, excuse me, Skin Bleaching Prohibition Repeal Bill 2020, the Gambia Nationality and Citizenship Amendment Bill 2020, Births, Deaths and Marriages Registration Amendment Bill 2020, and the Domestic Violence Amendment Bill 2020. Those in favor, please say aye. Those not in favor, please say no. Therefore, the committee stage of the above mentioned bills are hereby extended till the 4th ordinary session of the Assembly. Thank you. Any more motions?
Madam, I have an observation again.
Sorry.
I have an observation. Madam Speaker, for the purpose of clarity, the movers of the motions quote provisions from the standing order by only giving the name of the provision. I think for clarity, if one, for example, it has been read, let's say, for example, with the authority of section 75R, and it is read that we know that this is what the section 75R says, then the subsequent movers can just read the name. For clarity, Madam Purpose.
One document which we should all try to master, so if a section is referred to, we all read it at the same time, and in fact, it's a very short, it's on the standing orders. Yes, Honorable Member for Banjul North.
Honorable Speaker, in accordance with clause 53R and 66(4) of the standing orders, I rise to move that the committee stage of the undermentioned bills be extended until the 4th ordinary session of the Assembly. 1. Labour Amendment Bill 2020. 2. Forced Labour Amendment Bill 2020. And this is a joint committee engagement. Thank you.
Any seconder? Lower Fuladu West.
Thank you very much, Madam Speaker. I rise for second motion.
Thank you very much. It has been moved and seconded that the committee stage of the undermentioned bills be extended until the 4th ordinary session of the Assembly. 1. The Labour Amendment Bill 2020. 2. The Forced Labour Amendment Bill 2020. Those in favor, please say aye. Those not in favor, please say no. So the ayes have it. The committee stage of the above mentioned bills are hereby extended until the 4th ordinary session of the Assembly. Thank you. Any more?
Yes. Honorable.
Yes, Sir Akunda. Yeah, let me take, I've already given the floor to the Honorable Member for Sarah.
Thank you very much, Honorable Speaker. I rise to make a motion without notice on the Standing Order 53R that after consultation with the office that we cannot comply with Section 66(2)A, which gives us 16 weeks to complete our task as a committee, and by virtue of the fact that the 16 weeks will elapse before the 4th ordinary session, I rise to move on the Standing Order 66(4) that the bill entitled Public Service Pension Bill 2020 be extended at the committee stage until the 4th ordinary session of the Assembly.
Seconder, Busumbala, yes, thank you.
Thank you very much, Madam. I humbly rise to second the motion.
It has been moved and seconded that the committee stage of the bill entitled Public Service Pension Bill 2020 be extended until the 4th ordinary session of the Assembly as indicated by the mover. Those in favor, please say aye. Those not in favor, please say no. So the ayes have it. Thank you. The committee stage of the Public Service Pensions Bill 2020 is hereby extended until the 4th ordinary session of the Assembly. Yes, thank you. Any, yes, Serakunda, you have something? Sorry.
Honorable Speaker, I rise to make a motion without notice under Standing Order 53R that having done consultation with the office and taking note that Standing Order 66(2)A, which gives us 16 weeks to complete our task, and taking note that the 4th ordinary session will be convened and that our task will not be completed before 16 weeks, I rise on the Standing Order 66(4) to request that the committee stage be extended of the bill entitled Petroleum Commission Bill 2020 be extended until the fourth ordinary session of the Assembly. That the bill entitled Petroleum Commission Bill 2020, that the committee stage of the bill entitled Petroleum Commission Bill 2020 be extended until the fourth ordinary session of the Assembly.
Jara is seconder.
Thank you. I rise to second the motion.
That the committee stage of the Petroleum Bill 2020 be extended until the fourth ordinary session of the National Assembly sitting. Those in favor, please say aye. Aye. Those not in favor, please say no. So the ayes have it. The committee stage of the Petroleum Bill 2020 is hereby extended until the fourth ordinary session of the Assembly. Thank you. Any more? Environment? Yeah, sorry. Sandu.
All right, thank you very much, Honorable Speaker. I just want, for the purpose of clarity, the Honorable Member for Banjul North stated that the Labor Act should be a joint committee, so I don't know which of the committees is.
It's a joint committee between trade and...
Thank you very much, honorable members. Clerk, can we proceed?
Motion. Continuation of consideration and debate on the State of the Nation Address 2020, delivered by His Excellency, the President of the Republic, on Thursday, 17th September 2020.
Thank you very much. Honorable members will recall that the consideration and debate of the State of the Nation Address 2020, delivered by His Excellency, the President of the Republic of the Gambia on Thursday, the 17th of September 2020, commenced yesterday, Wednesday, the 23rd of September 2020. However, the debate could not be completed due to exigence of time, and the Assembly therefore adjourned. So today, we will resume the debate from where we stopped yesterday. But before continuation, may I request honorable members who wish to take part once more to raise their tags so that they will be recorded accordingly, so that we'll be able to manage the time. But again, before giving any honorable member the floor, may I once more just remind honorable members the rules of debate as enshrined under our clause 36, subclause 1 of the standing orders, which reads, every member shall restrict his or her observation to the subject matter under discussion. And also clause 37, subclause 1, reads, debate upon any motion or amendment to a motion or upon any bill, part of a bill or amendment to a bill should be relevant thereto, except in the case of a motion for the adjournment of the Assembly. So the emphasis is mine. We're debating the State of the Nation Address. I therefore call on all honorable members to respect and observe the rules as indicated earlier. And I thank you very much all. and I'll call on the honorable member for Tumana, who was on his feet yesterday when we adjourned. I still have the list, but I will not, Buddy Boop, I have my list, but we can still take additional. Yes, Tumana, thank you.
Thank you very much, Honorable Speaker, for giving me the floor. I think I'll just wrap up. Yes. Going through the speech again, Honorable Speaker, page 31. As additional support, varieties of certified seed has also been distributed to them. Furthermore, after 23 years, arrangement has been finalized to revive cotton production in the country with assurance of a market in Senegal. This is a very good move. I was expecting to have this in the speech, because this is something that we've been talking about since last year or year before last. Yeah, but then what I want to know, or the clarity I want to get from this is why the market in Senegal? Why the market in Senegal? Is this a short-term plan or a long-term plan? Because I believe this is an area that employ a lot of people in this country, especially in my region, most particularly Tumana constituency. We can think of, having our own textile industry in this country that will also open up to many young people, that will serve as a employment opportunity for them in URR. And going through it again, page 43. I wanted to talk about something, but I think I will list that with the minister. But then there is a mistake, I think, where you have page 43.3, additional over 687. That's what is in writing, but 680, that's in figure. So I don't know why that discrepancy is. I think they have to look at that. Let's check. Page 48. Yes, that's under transport, work, and infrastructure. I have a lot of concerns under this area, but I will leave that to the adjournment debate because the life and the livelihood of my people has been affected by the construction of that route from Mansajang to via Mansajang, via Tumana to Kantora, and the UNOPS project too. So I want to raise certain concerns so that the ministry can take up with those issues. Honorable Speaker, you go to page 50, that was talking about this COVID-19, something like that. So at this point in time, I really want to thank the Minister of Health for the tireless effort that they've taken, or the giant step that they've taken to help the people of this country in trying to combat with COVID-19. And notwithstanding too, I also want to extend it to the Red Cross Society, MRC Gambia, and nurses and doctors of this country, civil society organizations, political parties, local councils, religious leaders, everybody is in this country, because honestly, it will be very difficult if these people did not take part in the entire process. So thank you for that. So the only clarity I also want to get from the minister is about that's page 51. I must add that plans are underway to construct 8 permanent treatment centers and refurbish other isolation centers across the country. Can the minister be specific when he talks about across the country? Can he be specific towards that? And going to page 52, I wanted to talk about that. That's about this maternal mortality, but I think the issue has been addressed by him again. But notwithstanding too, I think where he was trying to say that there are numerous issues that relate to this maternal mortality, I was expecting for him to add lack of health center in some areas or some part of the country, but that was not indicated in his speech. Maybe I think that should also be added to his list of issues that lead to maternal mortality in the country. And water resources as final. Yeah, I want to hear from the minister himself to talk on the, like last year, I think my constituency, 6 communities or 7 communities should benefited from a borehole from the Minister of Water Resources. But then up to now, we don't know what is really happening or what is holding those. So I want a clarity on what giant step is he taking, though we are in COVID-19, but then I don't know how they are working on it. So that, I will have something to tell my people, because at some point, there are a lot of attacks that, yes, the government says this and they are not doing that. So at least a clarity on that, so that, I'll be able to tell them what is happening with those boreholes. So on that note, Honorable Speaker, thank you so much.
Honorable Member for Woolly East.
Thank you very much, Honorable Speaker. I also rise to contribute to this address made by the President of the Republic. And we thank the President for the address. Honorable Speaker, I've read the address, but one thing that the people are very much concerned about has not been highlighted, and that is inflation. Inflation is on the rise. The price of fish in the market, oil, rice, all the essential commodities are going up, despite the fact that the restrictions, COVID-19 restrictions, regulations, had put some control on prices. So that is one area I think we need to look at. Also, there is mention of biometric cards being postponed at some point, which has affected the income that we could have derived from that area. I'm just wondering at what point was the postponement, because I know for sure that people were issuing ID cards. I got my ID card about a month or 2 ago. So I know there is always a crowd there, but whether it's only one place or it's across the country needs to be explained. Honorable Speaker, on page 33, on page 15, on the $31 million social safety net, which is carried out by the NANA, I believe it's a laudable project. It has gone a long way to impact on the lives of the poor people. And we thank the Vice President's office for the role they play, as well as the NDMA. It was a tedious exercise for them, and it's definitely applauded across the country during these very difficult times. However, Honorable Speaker, my question there is, it is only done in one sector, one area of the country, when it is out to alleviate the, or is targeting the poor people. And I believe poor people are everywhere. Where I live is a mass with poor people. People have difficulty to have ends meet. So why not target the whole poor people across the country rather than just one section of the poor people? They say it's done only in the rural areas. I want to think that disasters are prone. Almost every year we have disasters. COVID-19 is one disaster, but we have other disasters as well. So I think we need to make special allocation, either in the contingencies fund, which will be there just mainly to support disaster victims. I think that will be very, very important, rather than just depending on external donors, which may fail sometimes. Honorable Speaker, on the small and medium enterprises and entrepreneurship development, where it is mentioned capacity building to train the youth on marketable skills, I believe that's a welcome move. But I was thinking that how do we create room for these youths to start small businesses? How do we fast track it? Because in many countries, Honorable Speaker, even in the region, there is a specific threshold in terms of investment, which is just meant for the indigents of that country. For example, some would say any investment below $5,000 or below $5,000 should be left to indigenous businesses. And any business, any investment above 5,000, is open to external investors. This will create room and space and encouragement to youths to engage in business. Honorable Speaker, on page 31, there is a mention of 11,000 metric tons of fertilizer for sale to farmers. I think this information was provided a long time ago. I know the information is correct, but then along the way, I believe something happened that makes it difficult for farmers to access this fertilizer. At the tail end, almost a month before the time allocated for usage of fertilizer, many farmers were struggling. In the end, we are informed that NEMA project had in fact bought all the fertilizer from the distributors, and then farmers were not able to access the fertilizer as they would want to have it. Honorable Speaker, also on the price of ground, that is agriculture, we need to strategize, because the last season, we all know the harvest in Senegal was not good enough. And there was a lot of people coming from Senegal to buy the price for the groundnut from the Gambians. And then the price went up. But I'm also informed that Senegal has also invited Chinese to purchase groundnut, and that also increased the price. So the shortage and the willingness of the Chinese Senegalese to increase the price has taken the price far above the farm gate price that is allocated by the Gambia. And therefore, farmers were not willing to sell their nuts to the secos. They instead sold the nuts to individuals, mainly from Senegal. And this has deprived the Gambia of the foreign exchange that we are supposed to accrue from this. So this time, Honorable Speaker, I think we need to study not only our own internal market, but I believe we need to look at what is obtaining, especially in Senegal, because it's our main competitor when it comes to selling granules, so that we don't miss to have our own groundnut, which is produced in the Gambia, to be sold to our own companies. On page 36, Honorable Speaker, for water resources, it has been mentioned that the process of procuring essential substances and equipment, including water storage facilities to improve water testing, purification, and distribution. Honorable Speaker, that is something that we are looking forward to. It's very welcome because the new projects, water projects that took place in my constituency, and I'm informed also that even other places also were affected. The water changed almost just 1 month or so after opening the tanks. So people begin to see different color, and the ordinary person really need the water, and they keep on drinking the water, but it may not be safe. So any testing, purifying, or whatever, that is coming in that way, I think is an improvement, which we are going to welcome. On page 40, Honorable Speaker, we've been informed a long time ago that the national sports policy is going to come. So now that we are informed also, we feel that that is long overdue. A lot of youths in the provinces have no faith that the state will provide anything for them regarding their fields, etc., etc. You can know that the people of Diabuku has already taken the bull by the horns and built their own mini stadium. I know they are on that process. But the people of Sutukova, also the youth, are contributing their own little thing to ensure that they fence their... So you can see the need for any support from the state to ensure that their infrastructures are taken care of. And anyhow, that can be fast-tracked so that we know how to come in, so that there is coordination with what people are doing on the ground and what the state intends to do. Because only after building something and then the state comes and brings that down and, will be a waste of resources. On page 48, that is the Lamenkoto Pasamas Road completion, which is uploaded by the people. We are all very happy that we can move not only smoothly but very fast, go and come. However, Honorable Speaker, one thing that remains to be addressed is that the way the culverts or the water passage system was built in some places happened to create a lot of havoc, either destroying fields that were before not affected by water, or entering residences and destroying houses because the original waterway has been diverted because of the way the road is built. So if you go to Sutukawa, you go to Fodekunda, Pasmas, they are all affected by this. So I will call on the ministry, urge them to make a close look. I know they have already sent some people there, but not much has been done to look at it closely and see. Talk to the local people because they know better. They know what used to obtain there, so that whatever you are coming to build will not affect them after that. Honorable Speaker, in the area of communication, page 50, I think it's 58, that's information, communication, and infrastructure. There is this migration of analog to digital broadcasting. And I think the GRTS has introduced a satellite dish, which you have to buy for something like 1,500. And just about one year, less than 1 year or so, then they introduce another one and discard this one. And that one is even more costly because it's about 2,000 something. and then people have to rent it from them. So that has affected many people from accessing GRTS television. So I will need the minister to make some clarification on that. What is the progress of that transition from analog to digital? And how can they can ameliorate some of the complaints that we have in that area. Honorable Speaker, take you back to page 33. On petroleum, we are informed that there has been a rescheduling of the drilling that was supposed to be done in 2020. Now it's rescheduled to 2021. It will be important to know, Honorable Speaker, what impact that has on the economy, or what implications that has. Is it just a delay, or does it have economic implications as well? I think that is something that we will want to know. We need an explanation on that. On environment, Honorable Speaker, I think that will be my last. Now that the beautiful highway has been built from Lamenkoto to Pasamas, we were in Belgium, and driving from Belgium all the way to The Hague in Holland. We have both sides of the road are planted rows of trees from one country to the other country. It was beautiful. Not just beautiful, but also contributing to biodiversity, also building ecology, etc., etc. So, what plans can the Ministry of Environment do if they cannot do it on their own, but to facilitate the communities along the highway to build roads, trees, to plant trees along the road from one end to the other? I think that will go a long way in building our environment. On that note, Honorable Speaker, thank you.
Thank you very much. Honorable Member for Nyamina East.
Thank you very much, Honorable Speaker. Honorable Speaker, the exercise before us, it is actually in line with the Constitution and, of course, the standing order, because the Constitution, in accordance with Section 77(1), it is mandatory that the President must come to the National Assembly to address the nation. Again, Honorable Speaker, Section 108 of the 1997 Constitution did indicate that the National Assembly must prescribe their own procedure, which we refer to as our standing order. And Clause 24, one of the standing order did indicate, Honorable Speaker, that if the National Assembly is on session, at least if the President is to come and address the nation once every year, that must be done in the first quarter of the year. That is exactly what the standing order is talking about, Clause 24, one of the standing order. And this document is derived from the Constitution, Section 108. So obviously, Honorable Speaker, all these two documents are legal. And if one is to practice such thing, there is need for us to take caution of the standing order as well. If the ministry is not actually aware of some of these clauses of the standing order, there is need for the National Assembly to enlighten them to understand some of these things. Honorable Speaker, it is like we were expecting, of course, the President to give us plans, policy, and program of the government so as for the honorable members to know what and what is going to be the policy of the year, that's 2020. But waiting until the tail end of the year 2020 is like you are just giving a report. And I peruse the document, Honorable Speaker, that is before us. But all that, of course, I have seen is like the president is just reporting to the state, whereas we were expecting a policy and program plans for the year, that's 2020, Honorable Speaker. There is need for us to take note of that, Honorable Speaker. Honorable Speaker, the document, of course, almost all the sectors are actually in one way or the other touched by the president. We are enlightened what actually the government achieved, what are actually the plans that are in place, and of course the achievement that they have registered in each of these sectors. Honorable Speaker, there is need when such document is brought before the National Assembly members for us to take cognizance of the NDP that we call the National Development Plan and the SDGs, Sustainable Development Goals. Because when the new government came into being, they indicate to the Gambian people that there are outstanding issues that we need to address. And for us to address some of these outstanding issues, we need a collective responsibility. And in doing so, the nation decided to come up with what we call the National Development Plan, NDP, and of course the Sustainable Development Goals. So anything that this country is working towards, we must take note of these two documents because we are working towards achieving the most fundamental things that are embedded in these two documents, Honorable Speaker. Honorable Speaker, we are not ignorant of the most priority issues that are embedded in these two documents that I am referring to. That is the National Development Plan and of course the SDGs, Sustainable Development Goals. One of them, Honorable Speaker, it is embedded on the document that is before us, that is the State of the Nation Address, is the reform agendas, Honorable Speaker, because here in the Gambia we have been advocating for this, that we need a change and we need to address some of the things that we believe that they are wrong. That is why some of these reform agendas they were brought for different commissions to be established in order for them to take charge and start doing their function. Honorable Speaker, we are very much aware of the TRRC, which is ongoing and yet to be completed, which is part of the agendas of the reform. Honorable Speaker, there was also this commission called the Jana Commission, the Commission of Inquiry. It is completed, and of course, every individual here, we know what transpired in that commission. And of course, the recommendations and what are some of the measures that are undertaken by the government and the authorities responsible. Honorable Speaker, again, we understand that the CRC, the Constitutional Review Commission, which was one of the major things or reform agendas that this nation was advocating for. And we have seen also what really happened as long as the CRC is concerned. It is dead and gone, Honorable Speaker, which actually I, for one, I was not praying for. I, for one, I was not advocating for such. I, for one, I was not actually thinking that maybe that will be the end of that. But maybe there are means or possibilities that can come up next. But this is what we have experienced for so far, Honorable Speaker. Honorable Speaker, agriculture, education, you talk of health, and of course the economic of this country. These are also major things that are embedded in those two documents. So these are some of the things that the president was trying to address. And all these things that we are talking about, these are things that are sourced or resourced from the taxpayers' money. Be in the health sector, be in the educational sector, be in the agricultural sector, forestry, petroleum, and so on. All these sectors, of course, in one way or the other, if not all, but most of the things that we believe that we can do in some of these sectors, the taxpayers' money must be involved. So there is need in such a document. It is brought before the National Assembly for National Assembly members to take note and take charge. They have reported to us. This is what exactly they are telling us. Figures are given, statistics are given, and other substantial things are given embedded in this document. So it is the duty of the National Assembly members to see, to verify, to investigate, to ensure that whether or not some of the things that are mentioned in this document are accurate or not. There then we are taking charge and we are representing to let the people or the electorate know what actually the president said, that what actually happened. Our investigation will tell, Honorable Speaker. Honorable Speaker, to move further, I will touch on the educational aspect. Honorable Speaker, this is the area that we believe where we can build the mind of the generation or the young people. This is the area where we think we can build the cognizance of the cognitive of the young people. This is the area where we believe they will take charge of this nation tomorrow, Honorable Speaker. So there is need for us to give a greater attention to this very domain. Honorable Speaker, we are told by the President, if you get to page 46 of the document, you will get to know that we are told that 673,300 students directly affected because of COVID-19. This is a clear information. We are aware of this information. What is the other thing that we are going to do, Honorable Speaker? The ministry came up with an initiative that we call the radio and the TV program. Honorable Speaker, in this case, I will applaud the ministry for coming with such an initiative. It is marvelous and fantastic for us to come up with this so as to engage the children who are out there, the children that will take charge tomorrow, the children that will take responsibility of this nation. But I will try to confine my intervention in this area to the people of Nyamina East regarding this program we are talking about. Honorable Speaker, the people of Nyamina East, especially the students, when this program was ongoing, they were deeply affected because they were not benefiting as expected. One, most of the people there, their parents are, of course, they don't have television to watch or to follow this program. Two, some of them don't have radio to follow this program. In fact, whereas they don't have that energy to ensure that they can follow this program. So these are some of the challenges that the people or the students of Nyamina East were encountering as long as this program is concerned. Honorable Speaker, this is a challenge. We have the intention to continue with this program. But if the resources are not actually enough or sufficient for us to continue with this program, I think we must come with measures, plans to ensure that we see how best we can reopen schools, provided that some of the arrangements are done and people are protected as long as COVID-19 is concerned. There is need for that, Honorable Speaker. Another approach must be taken so that the children out there, they can also benefit so that their education can also be taken care of, so that they can have that quality education we are advocating for, Honorable Speaker. Moving forward, we move to the agricultural sector, Honorable Speaker. I am a child of a domestic worker, and I am proud to be a child of a domestic worker, Honorable Speaker. And if you are to empower me, my people out there, their area is actually farming. I myself, I am a farmer. Barely 2 months I am there. Within Nyamina is doing my farming. But the number one key challenge that we are experiencing there, Honorable Speaker, the fertilizer issue. If you get to page 30 of the document, Honorable Speaker, you will get to know what I am saying. Tons of fertilizers were distributed within the country. I am not disputing that, Honorable Speaker. But the measures that we are taking to ensure that they access the fertilizer was actually a challenge. Previously, farmers within Nyamina East appreciated the initiative that were taking place. But for this year, my farmers within Nyamina East, of course, what they were doing in order to access this fertilizer, they will go to Birkama Bar, all the way Nyamina East to Birkama Bar, pay whatsoever number of bags of fertilizer that they have to buy. They will be given a receipt and they will get to another place just to collect that fertilizer. This was just a challenge. And farmers, they bitterly complain about this challenge they were encountering. One, is time consuming. Two, extra expenditure. And three, they could have used that energy to work on their farms. Honorable Speaker, what we are really recommending to the minister, we have places where this fertilizer can be deposited and within Nyamina East, and these farmers can go there, make their payment, collect this fertilizer. If you think that you cannot just deposit whatsoever there, then we will recommend the agent who is there in Birkababa collecting this money to be coming to Nyamina East for people to make their payment, then go and collect their fertilizer. This can be done rather asking farmers to go to Birkababa just to make their payment, be given receipt, then they go and collect their fertilizer. I was making investigation on this, Honorable Speaker, but what my investigation did reveal, Honorable Speaker, is I was told that people, agencies that are there collecting this money, normally they have a challenge of submitting everything that was given to them. But I said, farmers should not be punished for those agencies not submitting whatsoever that is given to them, because no farmer, I repeat, no farmer will collect a bag of fertilizer without making full or complete payment. That can never happen. So that is not the fault of the farmers. That is between the authorities that sign this contract or that are actually working together to ensure that they have this fertilizer sold and collect this money. Honorable Minister, you can take note of that. Honorable Speaker, another burning issue, because COVID-19 definitely hinders everything in this country, and the agricultural sector is not an exception. The trade season is coming. Farmers, they encounter so many challenges they have suffered. Farmers actually sold some of the things that they believe that they could have used during this season, and obviously they don't have adequate resources or materials in order to embark on their farming. As a result, the little that they have working on them, on the farms, now that the trade season is coming, we of course have perishable goods that are already right out there. But the provincial markets are not open, Honorable Speaker. There, I mean the lumos. It is there where the farmers can sell some of these products that I am referring to. But what the Senegalese are doing, they are coming into the country because we said we have closed our borders. And the number one key thing today that the Minister of Health will tell you, they will give you the justification of saying it is because of COVID-19, we don't just want to allow the Senegalese to be coming. Because most of the provincial markets that locally called the lumos are normally occupied by the Senegalese. Where are our borders? Where are our securities? What are the responsibilities? What are the duties? What are the things that they are doing? It is not the duty of the farmers out there to ensure that all these things are done. They have paid their tax, they have paid the securities, they have paid the ministry to ensure that all these areas are protected. And we continue seeing the Senegalese coming in this country. You and I, we know about this. Every individual who is within the borders, you know about this. And yet, the Senegalese are coming, giving a price to our farmers for them to access some of these products or commodities at a very, very low price. Is this how we want to empower our farmers? So I am recommending, if there is a possibility, the ministry responsible, let them take charge of controlling their borders, and let us have our lumos reopened so that we can have some of these things, this market taking place. Because that's the only way the farmers can at least see value of what they were working on, Honorable Speaker. That is very important. The groundnut, I don't want to get into that. The Honorable Member for Woolly East did emphasize about it. These are some of the things our people are complaining out there, Honorable Minister for Agriculture and Health. See how best you can collaborate so that we can create that market for our farmers to sell their products, so that they can realize the value of the products or the goods or the commodities they were working on. Honorable Minister, Honorable Speaker. Honorable Speaker, the Ministry of Youth and Sport, it is very important. I said I can never speak in this assembly without mentioning the issue of the young people. I could remember vividly again during the last budget session with the Ministry of Youth and with the Minister of Finance. Because since we started this National Assembly, I mean the 5th legislature, we continue having the young people, the budget of the young people below 1% of the national budget. And we keep claiming that we are empowering our young people. I believe if we want to empower our young people, the number one key resources that we must take note of is the little resources that we have. It is our resources that we have, we must start it from there. No one can defend that anywhere, that the youth of this country, they cannot even secure 1% of their national budget. I cannot just explain that anywhere. I cannot just defend that anywhere. And I could remember voting against that. I can remember voting against that budget line of the Ministry of Youth and Sport, because it does not tell well about me. It does not tell well actually about how we are treating our young people in this country. So obviously, I cannot continue approving a budget line for the young people which is below 1% of the national budget. The justification was from the Ministry of Finance, the sport levy. The Honorable Minister for Youth and Sport is available. I don't know actually whether the sport levy started coming or not, Honorable Speaker. So I will want the Honorable Minister for Sport to enlighten me whether the sport levy that was actually mentioned by the Ministry of Finance, whether the money started coming or not. If yes, what are some of the things that we have started registering as long as that package is concerned, Honorable Speaker? Honorable Speaker, NYSS is an institution established in order to be training the young people of this country and to give them skills in order to establish themselves. NYSS last year, 1,800 young individuals applied in that institution. They were able to absorb only 200 out of that 1,800, meaning 1,600 young were rejected. I think this is very alarming, and there is need for the ministry, the government, and of course this National Assembly to see how we can empower that institution, because they are doing a great job. They are definitely helping our young people. But it's because of the resources, the limited resources there that they have as a challenge, that is why most of these young people are rejected when they apply. Imagine 1,600 young rejected when they applied. Only 200 were taken. This is very serious. And of course, in that institution, there is this we call the National Youth Service Program. There is need, the Ministry of Youth and Sport knows what I am talking about. There is need for us to start having that program in place so that we can start the implementation. Because that program will enable the young people to start doing some of the things that we believe that will empower them. That program will enable graduates from the university, graduates from GTTI and other institutions to start working in various institutions to ensure that they give the service to the people, especially the young people at the grassroots. I think there is need for this National Assembly to start giving consideration to that very program so that we can have our young people engaged in one way or the other. Loading bags of rice, you call it, and whatsoever, you don't call that a job opportunity for the young people. That is not a sustainable thing we want to engage our young people. We want a lucrative job to engage our young people, to empower them, something that is sustainable, where they can have that best, if not best, but a standard living. This is what we are talking about. If you get to the quarrel, you get to the cement factory, you see our young people loading and offloading. And we don't just want to see our young people doing that alone. We want this job to be sustainable, Honorable Speaker. Honorable Speaker, moving forward, the food package, the President did indicate in this pandemic, the government took the initiative to at least provide a food package for the most vulnerable people. And we are cognizant of that. We are aware of that. We actually visited our places. I, for one, I did so. Going around to consult the people, going around to know what actually, how the distribution was and everything. But there are so much challenges. And the Honorable Vice President is aware of that, and she was called, I could remember here, and that question was asked. Some of the vulnerable people out there, they still don't even know whether the food package we are talking about, bags of rice, whether it's a blue bag or it's 50 kilo or 25 kilo. They don't know because they are not given the chance to access it. They don't have it. The Honorable Vice President did indicate before the Honorable Assembly that they are working on that to provide this for the vulnerable people out there who are yet to have this food package. Yet, the people out there are still crying without seeing this. I don't know how far they have gone, but the people of Nyamine is a greater number of the people out there within Nyamine is some villages they are without this at all. In some villages, others will have it, others will not have it. You get to a compound, others will have it, others will not have it. I don't know what was the statistic they were using. I don't know how they were able to figure out this to ensure that the food package was distributed. They need to tell us, because the councils were never in any way involved. And I believe they are the better institutions to define for us the statistic needed in order to access or to get the vulnerable people and have this food package distributed. But they were never involved. Reason best known to them. And there is need for that because they are the ones working at the grassroots. And they need to be empowered. Empowering them means when certain things like of this nature happen, we need to involve them. We need their service, irrespective of whatever. Honorable Minister, Honorable Speaker, there is need for clarity on that. And not long ago, this package food, this money that they are distributing, 3,000 at the provinces, there is a big challenge and there is need for us to address that because farmers and the vulnerable people out there, you as an individual, a task is given to you to go and distribute that money to the vulnerable people. After you have made your consultation, they have given you their details, you have given them a ticket, the individual came just to collect that money, you deny the person for having that money. What are you talking about? A money that is given to you, you are paid to go and do the service, you satisfy that individual by giving the individual a ticket that will attest to that individual who is giving the money that I am qualified to get this money. You have nothing to tell me, but after submitting my ticket, you are telling me you cannot get it. And you seize my ticket. I was there when this distribution was taking place. Many people come to my compound complaining about this, and I have to get to the grassroots where this distribution was taking place, and I have found that that's the reality. Others, their tickets were seized. Others, they were not given anything at all, and they have to go like that. The issue has to be addressed. Honorable Speaker, on that note, Honorable Speaker, these are some of the things that I have, Honorable Speaker. There is need for that collaboration. There is need for that unity. There is need for us to move with one agenda in the same direction. If that is actually what we are aiming to do, then we can move this country forward. Because it doesn't matter what tribe you belong to. It doesn't matter where actually you are coming from. But wherever one finds him or herself, you have a responsibility to play as long as nation development is concerned. And everyone should take note of that so that we can move this country forward. Thank you very much, Honorable Speaker.
Thank you, Honorable Member for Banjul North.
Thank you very much, Honorable Speaker. Honorable Speaker, the disadvantage of speaking last is that you might end up not having anything to say or little to say, because those who had already spoken before you might have explained what you wanted to say clearly, not just rendering you not to repeat what they have already said. But the positive thing also is that it makes life easy for you, and that your position would be fresh in the minds, especially in a situation like National Assembly where we have ministers whom we are expecting to be responding to our concerns. Honorable Speaker, I want to say that the President has fulfilled a constitutional requirement, Section 77, as stated by earlier speakers, 1, and that Section 77.3 also that the ministers who are supposed to be responding on issues that touch on their the portfolios under their purview are also here at hand to hear concerns and then respond to them. So we are talking, we are in the same line, we are now talking. This forum is an indication of that you have the legislature and the executive. Having said that, I want to say that the president in his speech, the speech was well presented, it flowed, but as has been indicated, it lacks details. And I believe that there is no better forum and no better time than the present time where we are facing challenges posed by the COVID-19. We were expecting that the president was going to elaborate in detail the challenges they are facing as an executive in terms of implementation of policies, so that as a legislature, we'll be able to intervene where necessary in terms of coming up with legislation, in terms of supporting policies, in terms of allocating resources. Honorable Speaker, the President started, let me start with the concluding remarks of the President on page 67. He said, the indication is that we are in a health, economic and social crisis that will linger on into the future, and a situation that we may have to live with. It poses challenges to contend with, not only with resources, but also with all the courage and energy we can muster. In the face of all this, my government maintains that survival, lives and livelihoods come first. In other words, we rank the people higher than anything else. Good. I want to use this as the premise of my intervention. That having said this, I was also expecting that the President was going to come up with, immediately after these introductory remarks, to start with the response that they have already started undertaking or implementing, and also the response in terms of plans. Honorable Speaker, if you should go to page 9 to 11, that is finance, the President has indicated to us the gloomy economic climate, indicating that what we are being faced with, that is the COVID-19 pandemic, will result to a decline in growth, well, in percentage terms 6%, from 6% to 2%. And that this will necessarily lead to shortfalls. He indicated the challenge in terms of economic activities, and that the current situation, it is estimated that about 20% of expected revenue will be lost. And that, well, in monetary terms, $2.3 billion, which represents 2.4% of GDP. That this is what the country is facing as a consequence of the pandemic. But I want to also make this very clear that Gambia, as well as many countries, are facing a rude awakening, in the sense that they are being caught by surprise by this pandemic, and that is against the background of being unprepared. So I was expecting that the President, and it's still not late, the Honorable Vice President, Honorable Speaker, is here, that it's an opportune moment that they will really give effect to Section 154 of the Constitution, creating a contingency. It is high time that the country starts giving effect to that provision, that this coming budget let us allocate amounts of money to cater for any eventual crisis, disaster, pandemic, whatever may come by our way as a crisis or as disaster. I was also expecting, with the concluding remarks I read out as taken from the conclusion of the President, that I was expecting a stimulus plan, so to speak, and I'll come to that, especially when I come to the relevant ministries where I was expecting it. And it's still not too late, as I said, that we can still devise, plans to assist. But let me start with the Interior, Minister of the Interior. Well, it is definitely welcome that the firefighters were engaged in the front line to help boost the work of health workers who are on the front line in the fight against COVID-19, and of course, by extension, the Minister of Defense as well, the soldiers, particularly those who have a medical background. That the lesson we should learn from this as a government, as a country, is that the men and women in uniform, there are security reforms. We don't know the outcome yet. If it is, well, they're going to scale down to make it very sizable, professional. But in addition to that, even if they are scaling down, those who are going to be relieved and those that are staying, it is important, and I really like that position, that the cycle of force, that coercive element in terms of the men and women in uniform, really needs to be expunged. They are service providers. Security is essential in our livelihood. So it's security, it's a service. In fact, we can even change from armed forces, we call armed services. The police force, as you know, is indicated in the constitution that was that did not pass through, intends to change the name Gambia Police Force to Gambia Police Service. So as service providers, how do we help them? That I'm a police officer, I'm a soldier. I am not only trained in the skill of using weapons, defending the territorial integrity of the people, preventing crime, but I'm also skilled in another area where life after the service as a police officer, life after service as a soldier, I can be productive in another area. IT. As you know, health is a challenge. They can be trained to be paramedics. Even medical doctors, they can pursue that. So that they will not dedicate their lives only to serving as security personnel after their retirement or after they have finished their contracts, 5 years, 10 years. They would not continue, if they wish, not to continue as serving as security, because as you know, some of them, they end up being security, serving in the security, private security. But they can also be engaged in other, other services. I would not say, because every work is relevant. I would not say more relevant, but they can be engaged in other services that are really, needed. As I said, in the area of education, the area of health, even engineering, Minister of Works. So I think this is a lesson that I would want to impress on the executive and also the legislature, that how can we help our men and women in uniform whilst they are serving to acquire other skills which they can rely on for survival, not only but also to continue serving their country, their compatriots. So it's a welcome move that they have been engaged. And of course, at this stage also, I would want to salute all those on the front line who are between COVID-19 and the population, for risking their lives, for the sacrifice, starting from the minister down to all those that are there, Minister of Health and other ministries that are also engaged. So I have made it a policy, matter of policy, that wherever I am, the radio interviews, I start by saluting them, just to encourage them. As the minister here was before us, and appealing that those Gambians who are trained leaving the shores for greener pastures because better pays. Those that stay are sacrificing, so we need to acknowledge that sacrifice. On the OVP, we welcome the support being given to those families, those households that are vulnerable. Of course, it's not going to solve their problems entirely, but at least momentarily it can alleviate the impact of poverty on those families, on those households. So it's welcome, and then we can draw lessons from there to come up with more elaborate and more durable, more sustainable and durable interventions of that nature. Why not? Rather than giving them money for their sustenance, daily sustenance, can there also be an element out of that money, or to increase it, so that they will also engage in economic activity? You give me 3,000, okay, I'll give you 5,000 instead. The 2,000, you can buy fowl, chicken. You can buy something to process, to sell. You can use the 3,000 for fish money, for whatever that the family needs for their sustenance, but another part is going to be invested in an economic activity that will generate income for the family. These are all things, Honorable Speaker, that the Honorable Vice President and the Cabinet can take note of, rather than just giving them, they consume and that's the end of it. NDMA, I've seen that they said they have a post-COVID plan, COVID-19, but the other time I was cautioned that no, we might be living with COVID for some time. What we should be saying is post-pandemic, because the pandemic is certainly going to end, but COVID might be lingering if vaccine is not found earlier. Even if it is found, it will be with us until it is eradicated completely on the face of the earth. So, of course, I'm looking forward to that plan. At the level of the Assembly, we have committees, select committees, that would be engaging them to know what the plan is. Those plans are in detail. I think it's indicated that there is a health, there is one on health. It is on page 17, that, with your permission, Honorable Speaker, together with other stakeholders, the NDMA has developed a roadmap for post-COVID-19 on building resilience in the 4 key areas of health response, and I guess they'll be doing this in conjunction with the Minister of Health, Social Protection, Minister of Women, Children and Social Welfare, Socio-Economic Recovery Mechanisms, and the rule of law. Well, of course, in fact, these are the issues that we said. These are this is the lack of detail that we are talking about. That we were expecting that the President or whoever had helped provide this thing would have explained in detail what this entails. We ought to know as legislators, as indicated by the member for Serakunda earlier on, that we are partners. We often hear that, or partners in development. No one can go without the other. The executive cannot go without the legislature cannot go without. It's a symbiotic relationship, just Siamese twins. We ought to be, I don't think there is any National Assembly member who would want to see the government fail, because we are representatives of the people. If they fail, those that we represent are going to suffer. It is at their expense. So our wish should be to ensure that it succeeds, and we can only succeed if we engage them, perform oversight, effective oversight, give them legislative support where it is necessary, support their policies where it is necessary, allocate resources, if adequate, wherever it's necessary. This should be the spirit. We should be working in tandem, in partnership, to ensure that we realize our goals. At the end of the day, we are representatives of the people. We don't want anything to go against their interests. So that is that. Under the environment, the President indicated that there is this economic-based adaptation project, which is meant for the restoration of degraded forests and agricultural landscapes, with climate resilience plans, species that provide. Yes, this is welcome. In fact, in one of my interventions in earlier sessions, I was also talking about some of these wild fruits that we used to have when we were young in Banjul. Imagine Banjul. It's not only those who are from the provinces who are akin to these fruits. They have been coming here. In fact, all the wild fruits in the Gambia have been coming. I don't want to know their names because this language group may call it this name, the other may call it name, but like hell, nete, all those things. And these are good. How can we help regenerate these things? Have them in abundance. Because some of the illnesses that we are encountering now, perhaps the antidote, the solution, the cure could be found in these wild foods. So it's a good move. We revisit the flora and fauna and check those fruit trees, particularly the wild ones, that to ensure that we replant them, have them as many as possible everywhere, even in places like Banjul. We are talking about reforestation, tree planting. I would advise that tree planting we use fruit trees so that people will have something to consume as well. Not only the shade, not only fighting against climate change, but also it can be nutritious. It can help in prolonging life because it's providing food, vitamin life, so to speak. This is a welcome development. Waste management is long overdue. We need to have and they said that they supply plans for a waste management bill. I'm not sure whether this assembly, with all the pending bills that will be able to complete them during our term, our tenure, which is going to end, sometime in 2 years' time. But we need this. This is timely. You can see the environment. It's an eyesore, and it's a cause of illness. So I don't know what is important for this to be expedited. Honorable Speaker, the Honorable Minister is here, the Honorable Vice President. This is something that we really need to expedite. On the area of trade, okay, this is an area where definitely I would want the government to support the Minister of Trade. Presently, there are regulations in force that are affecting economic activities. And of course, as someone who is part of the Health Committee of the National Assembly, I am okay with the issues. I support whatever the ministry is doing, because I know it's based on expert consideration. Because physical distancing, that's the norm around the world, and it's proven right, correct. Video clubs, they're closed down, and they have been coming to us. I know someone who mobilized, because I told them that go and get yourself organized. And that's our problem here. Most of the operators are not organized. And I think if they don't take the initiative, government can help them to organize themselves formally, get registered, register where they are, in fact, they come to that in terms of employment, register where they should be registered, so that in terms of disaster, when you want to give them relief, you would know who to go to, who deserves relief, things like that. So the Minister of Trade, this is something that you can look into. How can government come and then stimulus package to help them? Because they are having difficulties with paying rent. Not only rent for their facilities, but their home, the houses that they rent. There's someone who has a wife, has children, going to school. Since March, he's without work. The landlord is pestering him, and two landlords. One is for the video club, and the other for his household. He does not want to let go of the video club, because for him, he's anticipating that very soon the regulation will be lifted. He will continue his operation. So he's having this challenge. He was coming crying before me. See? So it's something that government really needs to look into. How can they help those? And moreover, the Public Emergency Act, the law, indicates that in terms of regulations in emergencies, those that are affected should be supported by government. So government should be really invoking what the law states, what the law requires in terms of helping them. Of course, the minister talked about, the president talked about the Labour Act. A draft bill has been developed for a new Labour Act. And then currently, they are considering building an employment service center to facilitate linkages between job seekers and employers. This too is long overdue. We need to have this documented. Those that have skills, what skills areas, so that those that are providing the employers would have somewhere to resort to if they require certain services for their operations. And those with skills also would know where to go to. So this is long overdue. These are things that should be expedited. I'm not sure whether the fourth ordinary session will not be overloaded, but there are some plans, legislations, internal legislation, that should really come before us, if really time permits. They are long overdue because it's affecting people in their lives and livelihoods. And this is one of them. In terms of the bread, I know of someone who is forced to close down his business. He owned a bakery because of the challenge of distribution. They are somewhat being held at ransom by the distributors. They are working for distributors, so to speak. Here is an area where the Ministry of Trade can be assisted to help young people, those who are returning from the backward, those who are trained, to organize themselves, provide them with mobility, so that they will be getting these breads from the bakeries and then distributing them in a win-win kind of situation, as opposed to what exists. So this is also an area, an intervention area, that they can look into. The bread regulation is fine. It has to come into being. There are safety issues. You can see the bread, how a bread is produced, how it's distributed. You see someone sweating, doing whatever in terms of distribution, holding money, and then how do you also help young people, boys, girls, young men, young women, to have kiosks, bread kiosks? It has been experimented in other countries. I don't know what the outcome is, whether they succeeded, but studies can be made. I think in Senegal, the ministry can go there, undertake studies to see whether it succeeds. It's still going on in Senegal. If there are challenges, they learn from the challenges and see whether it's something that can be applied. How can we help them to be also distributors of bread? Not only bread, the kiosk can be distributing bread and other things, other food stuff, processed food. So this is an area of intervention that that the government can take note of. Honorable Speaker. Honorable Speaker, YEP, Youth Employment Project, is really supporting our young people in terms of skills acquisition and in terms of application of those skills, productivity and sustenance, in terms of their livelihood. So we really applaud them. The ministry with GBOS, well, as you know, they have indicated that with GBOS, the ministry had they are estimated that 52,000, over 52,000 people have lost their jobs. So, well, we know it's obvious as a result of the COVID and the other challenges. But what is government planning to do? This is something that really needs attention to see how we can reverse the numbers to make it zero, or even increase it on the other side, the positive side in terms of employment. In terms of foreign affairs, yes, I've not seen one key area, the young people who are being repatriated. What is the state of that repatriation? So what exists in terms of agreement between the Gambia government and those countries that that intend to, or are even repatriating, because the process has already started? In the face of the COVID, is it safe for us to receive young people being repatriated? And as you know, in Europe, the situation is now turning back they are now experiencing a second surge, and we're definitely going to be importation of more COVID into the country. Government also needs to look into that. If there are any plans, they should be put on hold. There should be a moratorium so that we will not receive any young person who is repatriated from anywhere in the world. The conflict over land and natural resources is being reported by the President that is being put on hold by the FAO had asked them to stop the process. But I think this is an area that government really needs to work on. What is the Land Commission is established? What have they done so far? As you know, there are a lot of crises. Well, there's crises abound in this country. in terms of land use, land ownership. And then it is the mandate of the Commission to address those issues. So what has been done so far, we are really curious to know as an assembly, because it is us, those that we are representing, that are affected. So we also wanted to know, so the Honorable Minister is here, the Honorable Vice President. We would want the work of the Commission to be expedited. And then I'm not sure whether they've started working, but if not, it has to be done as soon as possible towards resolving this crisis and also preempting the emergence of future crises in terms of land. Agriculture, yes, I understand that, well, the cooperative policy, the revitalization of the principles and values of the cooperative policy is being conceived, or it's conceived. The cooperative policy is conceived by the government. That means nothing is done yet, but as you know, it has a lot of advantages rather, for us to have this mechanism in place, cooperative. How do we help our producers, engage them in production? There's the culture of production in this country. It has been, age-old. But how do we organize them? And the cooperative concept comes to organize them. I think this is something the Minister of Agriculture should really expedite, so that we'll have a cooperative mechanism on all agricultural produce. And not only agriculture, but livestock as well. It has been said here that agriculture is not only crops, livestock is part of it. So the cooperative structure, I can tell you, helps a great deal if it is in place and run efficiently, effectively. It can go a long way in addressing poverty in this country. The issue of small ruminants, there was a project that was signed here, that was approved by National Assembly. I was expecting that this last Tobaski feast, of course, at the end of the day, the problems with rams was, somewhat eased. There were challenges but the rams were imported. I would not be exaggerating if I say more than 90% of the rams were all imported. And then we have good breed here. When we were young, there were Gambian breeds. What stopped us from replicating them? And this project, we understand that was the objective. So what is the fate of the project? The Honorable Minister is here, we ought to know. So that we wish that next year, come next Tobaski, of course, and any other fish, not only Tobaski, any other fish, Christmas, whatever, Gambians would be able to have this choice of imported ram or livestock and homebred livestock. Because I will not advise them to stop importation, because if you cannot guarantee supply, so that's a challenge. But provide them with choice. Plant protection, these are all necessary. Animal health bill, petroleum and energy. I have stated here at the assembly that the other day that if petroleum, if oil, the fallout that it is creating in other countries in Africa, the irony of having oil, yet you see abject poverty, countries like Angola, Equatorial Guinea, Gabon, they have it in abundance, but yet more than half of their population are living in abject poverty. The wealth is in the hands of the leadership, a few of them. I have said it here, and I wish it's not going to happen here, and I hope so, but that if that is going to be the case, let us not discover it at all. This is my position. In addition to that, it also has some environmental implications. If it is also going to affect our marine resources, let us not discover it at all. This is my position. So, Honorable Speaker, Honorable Minister, that's my position. Sorry for taking the position. On the fisheries.
Remember that we are debating the speech.
Yes, I am there. I'm confined in the parameters of the speech. Yes. The fisheries. In fact, there is no session where I have not raised the issues of fisheries. I think the Honorable Minister would even feel that I pester him with issues relating to fisheries. I don't know why, Honorable Speaker, the government is still not looking in that direction, investing in fisheries. The Minister told us that the country had generated 178 million plus dollars. These are as a result of fines, fees, and landing costs. Of course, the other challenge also, the lack of detail, is that it's not disaggregated. How much of this amount constitutes fines? How much constitutes the EU agreement? How much constitutes landing? That is also missing. It would have also been very helpful. But I can say in no uncertain terms that Gambia can get more than this out of our fishery resources, fish and fishery resources. We can do it not at the expense of depleting the resources. We can do it rational exploitation of our fish and fishery resources. We can also do inland fishing. How to call it? There's this other one. What is the name? The other fishery, not artisanal. The other one, hatchery. The guy do aquaculture.
Please, he's on his feet.
Yeah, I'm asking. I'm asking their aid. I want them to help me with the one. Okay, the aquaculture. You can also promote this. I can bet that definitely we can get more than this. And not only the money, but also employment. Not only money in terms of revenue to government, but also livelihood. The Minister is talking about how many Gambians being, over 1,000 young people are being engaged. As what? As deckhands, as inspectors. With the resources, we could have had factories on land. Our women folk, the young people can be engaged there in processing the fish. Now, Honorable Minister, Honorable Speaker, a fish that is not more than the palm, my palm, costs $50, in some instances $100. I have seen a video, 5 fish of this size, $500. Another one, smaller size, $250. And when we have the fish here, our ocean, the ocean is here, the river Gambia. It's an irony. It's an irony. Scarcity in the midst of plenty. That's the situation with fish in this country. We're talking about, they said those that are the fisher folks, most of them are Senegalese, so they've gone for this. Our young people are here. Those who are the deckhands on these vessels. It was said by the previous speakers that why don't we force them to be landing their catch here? Let us build factories so that they will be landing their catch here. It's our waters. They should not be landing their catch in Senegal. You are registered in the Gambia. You're only paying us license, and then your catch will go and land it somewhere else. It should be a condition. But we must invest. Let us buy fishing vessels. Let us buy fishing vessels. I'll not stop talking about this to encourage government to really look along these lines. Because some argument is that government cannot do business. But this is an area where it was thriving when government was in it. It was as a result of, as you all know, not properly managed. Proper management. That's why they failed. The IMF came up with their conditionalities. This is an area that's really underutilized. Youth and sports, of course, the levy is welcome, but I also want to applaud the initiative, the decision to transform to revive the Friendship Hostel. Of course, I have also been calling for the hostel under the current situation to be transformed into a COVID treatment center. If COVID is over, I don't know what the position of government is. We just, advising. They are the ones who make the decisions. But in the absence of that, it is something that can be a source of revenue earning. It has been before, Friendship Hostel. So it's a move in the right direction. And it's not only stop at refurbishing the building, that facility. You can also consider, if there is space, to erect other buildings. can be a source of revenue for the municipal, for the government to support sports and youth. Art, tourism, and culture. Yes, in some countries I've seen that they're coming together, even in Senegal. I don't want to be making references, but sometimes you are compelled to do so. I think they have a package for their artists, musicians, performing artists, sculptors. This is also another area. What similar package do we have as a government? I know the order is tall, but these are the things that government is expected to be coming to relieve suffering. So I would really want the government to consider a package for those, because most of them, they are so well dependent on tourism. And the tourism is crashed, so to speak. Thomas Cook, COVID. So what is the plan of government to support the musicians, the dramatists, those that do sculpture, those in the craft markets? Even by extension to taxi drivers, tourist taxi drivers, official guys, they're called bumpsters. Of course, small-scale operators, restaurants that are closed, the bars, these are all operators that really need attention and support. Higher education, Honorable Speaker, I am concluding now. Higher education, my concern is research. Research, all over the place, even Senegal, with this COVID, the government attempted to mobilize funds for their scientists to engage in research. Nothing should stop our government from doing that as well. Let us invest in research. And let us not underrate ourselves. I'm not sure whether we have that number of scientists here, or those researchers, but I guess we do have. Even Gambians who are in the diaspora, they can come. Gambia can also be a game changer. Gambians can be a game changer. The solution for COVID or other difficult, unresolved issues in the world can be discovered by Gambians. So government is an area the government should really look into. Research in science and technology. I'm glad, I'm glad to hear that the GTTI is being transformed into a polytechnic, a technology institution at a higher level, and we guess that they will be coming with innovations. In fact, the first car, African discovered car, we're hoping that it's going to come from there. I'm not engaged in wishful thinking, but it can be a reality. We have Gambians with brains. If we give them the environment, the support, the resources, even at a small scale, you can start with something. Those there with money can come, invest. So, Honorable Speaker, that is my take on that. For basic education, I think others have also dealt with that. And for health, my final intervention is on health. I normally do not want to talk on health because I and the members of the health committee, we have the opportunity to access the officials, the minister and officials. So I always reserve comments on that to that level, so that it always be on reporting when we are reporting as a committee, when we engage in findings. But I think the Honorable Speaker, you said earlier on that the office of, I don't know, the director is consulting with the, I was surprised that the committee was not involved. Of course, you finally said that you're going to engage the committee. But these are the things, if you go to our remit, as a committee, we have the mandate to be dealing with issues under our remit. So I believe the health committee, in fact, the issue that was tabled before the National Assembly by the honorable member for Badibu Central, who is also a member of the committee, was partially touched in our report. Unfortunately, we have a pending report. We went round. The National Assembly provided us with resources. We went round on the COVID, a second round, and prepared a report. It is unfortunate that we could not lay it before this assembly. I think it could have even set the tone before the Minister of Health came before us, so that members would be more informed as to the situation on the ground, what are the challenges, what are the strengths. They are all contained in the report. It's unfortunate that it could not be laid, but committees are doing work, and they should also be, they continue their engagements, oversight engagements, and then be reporting. So I guess whatever statement you might have should be channeled to the committee, the health committee, so that we'll properly engage them and then report. What the minister did was fine, but we also need to get them, engage them, so that together we'll find solutions, because that's the objective. All the oversight, the objective is solutions. All that we are doing is to find solutions to the challenges being confronted by our country.
I don't want to interrupt, but I think those are details that you could always work out within at the committee level when you come there, so that we'll save time, because we still have some more
Honorable Speaker,
interventions.
yes, in conclusion, I once again want to salute those on the front line, urging them to continue saving lives. It's a noble engagement, and that as a legislature, we are always ready to give you support. On that note, I thank you.
Thank you very much. Thank you. Honorable Member for Ilyasa.
Thank you very much, Madam Speaker, for giving me the floor. Although I have gone through the book, but Madam Speaker, the one thing we can do in this country, we have to change our attitude, otherwise this country can't be developed. We can be here talking till doomsday. Without changing our attitude, we can't move forward. Madam Speaker, if we open page 67 of present speech, if you could allow me to read. In the face of all this, my government maintained that the survival, life, livelihood come first. That's what he said. In other words, we rank the people higher than anything else. Excuse me. Madam Speaker, if we go to justice, excuse me, excuse me, I just. What the hell? Which page is that? Justice. Justice. Oh, thank you. Okay, sorry, Madam Speaker. Madam Speaker, may I read again? If you go to justice, in March 20, the Constitutional Review Commission submitted a final draft. New Constitution Bill 2020 was gazetted. Until the National Assembly, after 3 months period stipulated. What the President says. And if the President maintains this, the livelihood come first. Then, our side is disappointed that he didn't support this constitution for being losing about $160 million. Our side is disappointed. So that being the case, that's why I started saying that this country we don't even develop this country, Madam Speaker, only unless we change our attitude. And the way you love our family is the same you're going to love the country, otherwise you can't even move. Anyway, Madam Speaker, let's go for this case. It was highly embarrassing. The entire nation. Even if you give that money, I think that's consequence better for us than in vain. It's very sad. Madam Speaker, if you go to finance, we all know what he said on finance. But still now, he did not even tell us. The duty on rice was not even mentioned, but because it was a concern. People are not paying duty on rice, and still now there's no reduction of rice prices in this country. The government has losing almost millions of dollars on rice. The Minister of Finance here, I've been saying this, and I'll say this till doomsday, until they start paying rice, duty on rice. Madam Speaker, the transit trade also not mentioned, because we have so many problems of transit trade within EGOS region, and that also must be enlightened as far as the trade is concerned. Madam Speaker, and also, he has mentioned here allocation has been done. Okay, now. How much money has been cut from various departments, and how much has been allocated in various departments, and how much has been cut? That was mentioned here. We have cut, for example, National Assembly, how much was cut, and the amount was cut, the money and the had been expended. That was mentioned in it. So that will indicate, in the Madam Speaker, in terms of agriculture, although I have started remarks on agriculture, but that has been reserved, I will start only when you have a meeting, a committee meeting, from there I will raise. That being the case, that's my contribution, Madam. Thank you.
Thank you. Honorable Member for Sane Mentereng.
Thank you very much, Ma. Thank you for giving me the floor. I might be very brief in my intervention, as my colleagues from Banjul North said. When you last speak, you have a little to say. But nonetheless, Madam Speaker, I would start with the fisheries, which at this right moment affects the whole Gambian. Fish is a problem in the market. When I saw page 35, where the ministry said fisheries is a key revenue earner in the Gambia. And that's true, fisheries is a key earner in this country. But mentioning the amount of 178 million being generated from this fishery sector, that is from the EU. I have a question in mind. I say to myself, EU has given us this amount. How much are they going with? This is a question. How much are they going with? At the end of the day, they will accumulate that. If you have a problem, they'll come and give you a loan. And then at the end of the day, you see yourself trapped in your own economy. Madam Speaker, when I look at this amount again, I say to myself, we have a starter. The human resource is already there. What do we need to do? As I've been saying so many times, we used to have these Chinese at the beach in Burfoot. They build trawlers at the shore there. And these trawlers, if you evaluate them, what would not cost more than 4 million? How much do we have here? More than 100 and something million. With this, we can start with 10 trawlers, because we have the human resource. 10 trawlers. These trawlers would generate a lot of money in the near future. From there, we'll start to expand our resources. But that's not happening today. If you go to the beach, you find so many youths, ambitious youths. They have no help. I am urging the ministry to take these steps to make sure they create trawlers so that our youths can be employed, and again, the market will be sufficient with fish. This will enable us, because what we are facing today is the Senegalese that are controlling all our fishery sectors. If you go in town, the women are crying. Mostly they come and face me. They say, why are you restricting the Senegalese from coming? Because we have a problem at the fishery, they are at the beach, there's no fish. I say, it's not me, it's about the COVID-19. Senegalese have gone for the Tobaski, they cannot come back. There's no fish at the market. You can, as my colleague said, you can buy a small fish at the cost of $100 or $150, which many Gambians cannot afford today. Well, had it been, we have our own trawlers here, fishing here. And most of this fish that Senegalese catch here is all going back to Senegal, not here. All what we have in the market is the bonga fish. And people like me in Burfoot, I'm tired of eating bonga now. I've been eating bonga since I was a small boy. Charlo. Madam Speaker, page 27 is about land. Page 27.3, I will seize this opportunity to stress that the recent land ownership conflicts stirred by individual interest. Individual interest. Madam Speaker, an individual interest cannot supersede a community interest. People have been yearning for this land individually, and they end up selling it, putting the money in their pockets. I am glad the government has now realized that, and they are taking a bold step on that situation. Agriculture. Madam Speaker, if you go to Combo, every village you go to Combo, you have these big horticultural gardens. Our women are toiling both day and night. But the only problem they have now is the market. The market is the problem. After harvesting, they come to Serekunda, a small market, where some of them cannot even have where to sell their goods. Madam Speaker, I will urge the government to create preservation centers so that these women can get benefit of what they are working. And the government also can create a market for them. Like, for example, yearly you give them onion seeds. The whole horticultural gardens, you give them onion seeds. When they harvest, you sell them, keep them in their... This is how Senegal is doing it. And they are able to supply their whole country up to the extent of exporting it to the Gambia here. The simple onion we eat here is coming from Senegal. We can also do it. Why can't we do it here? We can do it. But how do they do it? We go there, study them, ask ourselves, how can we do it? And we can do it. Madam Speaker, disaster under the Vice President's office. Madam Speaker, we have seen the rice distribution after the COVID-19 pandemic. This rice distribution was not done in a proper manner, because I could fully remember during the First Republic, we have such distributions. But what they do was, they go to the central statistics, collect the statistics, and then this is how they distribute it. But in this other way, what they did was, I don't know other areas, but in my village, what they did was, the rice was given to the alkali, and alkali has designated so many boys to go around in town, in compounds, to get names. You will see a compound that is 15 will register 45, because they want to have more rice. that end up in some people not having the rice. And I've been receiving so many some people even call me on my next come to my house, knocking at my door, I don't have rice. Because somebody is taking your share. And the distribution was not done in a proper manner. That's why that happened. So I believe the next time such events are happening, the proper measures would be taken. Madam Speaker, Health, I would not hesitate to congratulate the Minister of Health and his team to say job well done during this pandemic. They were so committed, so dedicated to their country that they stood up, left their families, stood up to fight against this pandemic. And I say thank you to the Minister of Health. But in another sense, when you come to Combo, we have no referral hospital. All we have is health centers. And in my constituency, you have 2 health centers. And these are minor health centers. They are not major health centers. I am urging the minister to please consider seeing these 2 health centers, Sukuta and Burufu, to be upgraded into major health centers because their catchments are too much. Madam Speaker, Interior. We know the security is paramount in this country. Madam Speaker, you have a lot of thefts in town today, a lot of thefts. And you come to see there are small boys smoking cannabis, drinking alcohol, end up stealing. So I am urging the Minister of Interior to please help the anti-crime unit. They are doing a very, very, very good job in this country. Very good job in this country. Because some of the thefts they discover, you even wonder how do they discover it. Madam Speaker, youth and sports. When you say youth and sports, it's the youth's involvement or participation in sports. But let us not just stop in youth and sports. Some youths are not involved in sports, but they need to take care of themselves. When you go to Congo, there's no skills center. No skills center. You finish school, you end up hanging in the streets. And this peer garden, some of them, this is how they started smoking cigarettes and other things. I am urging the government to consider these key areas I have elaborated. And on that note, I beg to take my leave. Thank you.
Thank you very much. Honorable Member for Latrikunda Sabiji, since Foni Bondali is not here.
Thank you very much, Honorable Speaker, for giving me the floor. And also, let me also join my colleague to thank the executive for being with us here. Honorable Speaker, I think Honorable Member have just mentioned here something which is a key, is very important. And then also let me thank the President of the Republic for fulfilling the Section 77 of the 1997 Constitution. And then also, just to remind them that, if you look at our standing order, at the back of the standing order is written very clearly that approved by the National Assembly at the sittings of the standing order is approved by us Thursday, 12 September 2015 during the 3rd ordinary session in the 2019 legislative year. So what I'm just trying to say is that if you look at section 24 of the standing order of 1, that it says that the President should come here at the first quarter of the year. So we hope that the Vice President is taking notes so that hence going forward, they will make sure that that is done. Honorable Speaker, if you go to the speech of the President, that we call it a sona, we'll start with the introductory part where he says that if you look at his introductory part of section 1, section 2, he said, today my address presents the success and the challenges of the country that was on the steep rise towards economic boom and socio-political transformations when the unexpected struck. this was a sudden outbreak and rapid spread of the coronavirus, that is COVID-19 pandemic. Honorable Speaker, I think this alone say a lot about the speech, because almost everything that he was talking about is related to this COVID-19. Fine. That is okay. We have no problem with that, because we actually said this is what is happening in the whole world. But my question here is, if you go to Minister of Finance, we were told in the Minister of Finance, if you look at Minister of Finance, yes, Finance at 1, he said, Madam Speaker, the Gambia has been experiencing a slowdown of economic growth due to the reductions of economic activities as a direct result of the COVID-19. Madam Speaker, now my question here is, what is the plan of the government towards the recovery of the economy? Because it's important. We all know that something has happened. So what plan did they have? Because we are expecting to see this in the President's speech, to give us the plan, that's the roadmap to the economic recovery. That is the key. Honorable Speaker, I remember here vividly during our budget debate, when we talked about the domestic borrowing of the government, we are promised by the Minister of Finance that they are going to come up with the TSA, that is the Treasury Single Account. Now, this Treasury Single Account will help the government at least to reduce the domestic borrowing that they are doing. But during the President's speech, we didn't see anything of this. And this is a key if we really want to make a headway. We said it during our budget speech, during the budget debate, the Gambia government cannot keep borrowing domestically. Because when this happens, there will be a direct impact on the lives and the livelihood of the Gambian people. But we did not see anything about that. We want to know how far have they gone in that area. Because this is a key area in terms of, reducing the domestic borrowing that we are always into. Madam Speaker, if you just go down to the office of the Vice President, we were told by the Vice President, the President, that at least 84% of the household have been covered with the food aid during the pandemic, during COVID-19, 84%. And then everybody complained about these rice distributions. I think we don't know what is, I don't really know what is happening. Is it that the NDMA is not talking to the Vice President? Or the Vice President, the Office of the Vice President is not talking to the President? Because I don't think there is a connection, there is a link here. A ticket, let's say a coupon has been printed out to give to people, accepted by the Honorable Member for Serekunda. It's very simple. Once you are handed over a coupon, it shows that you must have that. You must have that rice, oil, and sugar. But how many coupons have been printed out? We want to know. And how many of those coupons received rice, sugar, and oil? And how many of them did not? That's important. We want to know. Because during the distribution of rice, many people will call you, I have my coupon, but I could not have access to rice, sugar, and oil. Why? Some people will tell you, I have a coupon, but I only have the opportunity to have rice. And on top of that coupon, it's written very, very clear. The number of rice, the amount of rice that you should have, oil, and sugar. So if you go and collect that one, at the end of the day, you are only given rice. What's wrong with your sugar? What's wrong with the oil? We want to know. I think the Vice President is here. He is going to make that very, very clear to us, because this office is directly on the hub. Madam Speaker, if you go to the fisheries, this Parliament approved the agreement between the Republic of the Gambia and the EU. And I am very, very happy. If you looked at if you go to the fisheries, that's the heading 12. We are told 178,710,608. That's what we gain from the agreement. Very important. This is very interesting. This is what we gain. Well, some might ask, what did the EU gain? I think that is not important here at this juncture. But how are we spending this money? This is where we need to ask the Vice President. Because we are told further that during this period, on the review, the industrial fishing subsector created employment for 1,036. And then if you go down, we are told fisheries observers and deckhands on board industrial fishing and vessels. We all know what has happened here. When this when these regulations were announced here, there was a point in time, if you go to the market, as said by the member for Ministerial, 3 bonga fish or kobo, chalo, you buy it $100. How can we afford that? So we want to know, let them come out and tell us, where are you spending this money? Because our agreement was very simple. This money is going to be invested back to the Gambian people. If you just give me a job, just assign me, I will, within 2 hours or 3 hours, I can get you 20 able bodies that are interested to venture in the fishing industry. But they didn't have the resources. And we were told during our agreement, it was very clear to everybody that the money that we are going to generate from this is going to be plowed back to the Gambian citizen. And this Gambian need to be empowered. That's the key. This is why we have some of this agreement. Honorable Speaker, if you just go further to Minister of Agriculture, it's a key area we all know. But there was a time here, we've approved a loan for Minister of Agriculture. Yeah, we know that government is supporting the Maro farm. That's important. But to me, it is not enough. We need many of those types. You know, let's just give an example. Let me just give you an example of how we spend about 700,000 plus to buy rice, sugar, and oil. And where is that money today? Out of the country. Because all this rice that we are buying, sugar, oil, are all imported from outside. So I think now we should have to change the table. Let us take the responsibility of empowering our own people. Let's work together to make sure that the Gambian people have what they're supposed to have. Madam Speaker, the rest of the points that I wanted to talk about is that when we come to the adjournment debate, then I will talk about that one. Let me just take my seat here. Thank you.
Thank you very much, Honorable. Yes, Honorable Member for Fonyi Bondali. Yes, Fonyi Bondali, thank you.
Thank you very much, Madam Speaker, for giving me the floor. I also want to join my colleagues to thank the President for fulfilling his constitutional mandate, and also want to recognize the presence of the Vice President and her Cabinet Minister. I have just few things to clarify, just the Vice President to clarify for me. If you go to page 12, under Minister of Interior, where the President said, in collaboration with other services, the Gambia Police Force has increased engagement in community and border patrol. So I want to urge to this government so that they can help us, we the people of Fonyis. Most of our villages are on borders, so that this police also can go to that area. Secondly, if you go to page 15, under the office of the Vice President, where the President indicated that the project targeted rural house in West Coast region, North Bank, CRR, URR, and Lower River region. Also they said that, and also he said that, He also mentioned that this project is going to help 80 households. 80 households. I want to know what criteria did they use to select these 80 households within West Coast region, and also whether Fonyi is also part of this project. That's what all I have. I want to thank you all.
Thank you very much. Honorable Member for Central Badibu. Yes, Central Badibu. Thank you.
Honorable Speaker, thank you for giving me the floor. Honorable Speaker, I want to make reference to 77 of the Constitution. 1. The President shall at least once in each year attend a sitting of the National Assembly and address a session on the condition of the Gambia, the policies of the government, and the administration of the state. Honorable Speaker, going to the introductory part of the statement, the President of the Gambia made mention of, he said, nevertheless, prompted by the national constitution, I'm obliged to officially report on my government's performance during the course of the last legislative year. Honorable Speaker, by looking at the document, the statement made by the President, it's not enough for discussion. All the institutions, if you look at them, the ministries, we have a lot that we need to be seen in this report. Almost all the speakers made mention, the President specifically mentioned, is going to talk about the challenges and the successes. We haven't seen the challenges and the successes. Though some ministries we have seen to it, that some of the achievements that they have made is mentioned, but they are not enough for us to make it an informed decision. And information is very, very important, because the information that we gather from the speech is help us to make positive decisions for the nation. Honorable Speaker, starting with your own office, this National Assembly, I haven't seen much that is said about the National Assembly. What were our success stories? What were our challenges? Are we not part of the state? Honorable Speaker, looking at the security sector reform, nothing is said about that. And of recent, we have seen where Senegalese military forces came up to Gambia, and this was a problem. We don't know how the problem was solved. We need to be informed. Honorable Speaker, going through the statement also, I have read about NAFA Quick. I don't know whether NAFA Quick, I don't know what do you mean by NAFA. I think, this NAFA, to me, we need to be informed. Do you understand? Why NAFA is limited to particular regions? Are we not all part of Gambia? If other regions are given support of 1,500, what criteria we are used? And what of the other remaining regions? What will happen to them? This is $1 million question, Honorable Speaker. Honorable Speaker, coming to the EBA project, it was a very wonderful initiative. You understand? But looking at North Bank region is the most vulnerable region when it comes to desertification. Why are they focusing on other regions? Why not Bank region? Honorable Speaker, we want to be informed. And what is the success story of EBA project? Where are they now? Honorable Speaker, looking at the Ministry of Works, Transport and Infrastructure, a lot has been done in that ministry, but we haven't seen anything. We want to be informed about the OIC project. We want to know the ports expansion project. We want to know about ferry landing site. We haven't seen anything in the report, Honorable Speaker. Honorable Speaker, coming to the individuals, civil societies, political parties, they all contributed towards COVID-19. They need to be recognized by the President. They need to be acknowledged for the effort done. We need to see ourselves as one people. We see Gambia, but it's not seen here in the statement. Honorable Speaker, looking at the local government and land, initiated a project on land and natural resources. Conflict over land and natural. This is a beautiful idea. But how are you going to make sure that we relate to the society? Land conflicts are all over the country. And they also have, the ministry has success stories in resolving conflicts. The chiefs, the alcalos, how are we going to empower their offices? We need to be informed. But nothing is said about the alcalos and the chiefs. What effort are they doing in our traditional dispensation? Honorable Speaker, we talk of Ministry of Fisheries. Yes, it's mentioned. The amount of money generated. But was, is it the agreement, was it only between Gambia and EU, we have the Chinese, we have the Senegalese. We need to be informed. We know that the ministry is doing a great job. As I'm speaking, they are handing over boats to some of the communities to support the youths. All those ones need to be featured in so that the people will be informed. So that if we are not informed, if you don't get the information that is required, we are going to say things that might be fallacious. So we have to be guided. Honorable Speaker. Honorable Speaker, coming to our justice system, nothing is said about alternative dispute resolution. And, these are some of the things that we need to cherish. We need to ensure that they work well. Honorable Speaker, as far as I'm concerned, the statement cannot help us to make a positive decision. So I want honorable members to consider either the ministries did not inform the president well as the projects that they are undertaking at their ministries, or the people who compiled this report did not do justice to the report. I thank you all for your kind attention.
Thank you very much, Honorable Deputy Speaker.
Thank you very much, Honorable Speaker, for the opportunity. Honorable Speaker, this document is indeed a very important document. State of Nation Address, 2020 legislative year, delivered at the National Assembly by His Excellency the President. Madam Speaker, the Constitution says, 1997 Constitution, executive power to the National Assembly. The President shall at least once each year to attend the sitting of the National Assembly, address the session on the conditions of Gambia, the policies of government, and the administration of the state. This Constitution made it very clear, and that warrants the President to fulfill the constitutional requirement and to address us. Madam Speaker, this document is a very important document. Since the Vice President is here, I would like to know, how does this document prepare? Because ministries by ministries have been featured in this report, and whether they've put in their submission to the office of the President, or in what form does this report compile? I want to know that, Honorable Speaker. Honorable Speaker, the report starting with Interior, Honorable Speaker, they indicate the revenue aspect of it, $139,672,840. That is on the side of the immigration, which was collected under the year under review. But, Honorable Speaker, that was the revenue aspect. Now, under the Ministry of Interior, we are told in this Parliament that that ID card production centers has opened in the country. I believe, really, in the President, in his State of Nation address, this should have been captured and featured in the report, and it was not featured. I just want to know whether the Ministry of Interior, in their submission, this was not mentioned. On environment, climate change, and natural resources, Honorable Speaker, that is the waste management on page 19. As waste management presents major environmental challenge for the country, waste management bill is under review to deal with the waste issues. Fine, the bill is under process. I like that. But, Madam Speaker, coming onto environment, this waste issue, plastics were banned by the former government in this country, and nothing has been done about it. The law is there. Anywhere you go in this country, madam, plastics are thrown everywhere. So the law is there to enforce. Why is it that the law is not enforced? I want to know. Honorable Speaker, coming on to land, regional government, NGO, and religious affairs, Madam Speaker. The land conflict in this country is all over the country. It's not in the West Coast alone. All over, all the regions in this country. And it's been going on for a long time now. I think government should stand firm to make sure that this land issue, the conflicts, to be wiped out. Madam Speaker, the Ministry of Lands, physical planning, Madam Speaker, I think could play a very important role with regards to these conflicts. I just want to find out from the Ministry of Local Government and Lands whether physical planning has not done the mapping of this country between the villages and the communities, so that this issue of between the communities will not arise. Community A said, I am the owner of this area. Community B said no. And the problem starts. I want the minister to give me that explanation. On the issue of agriculture, Madam Speaker, I think the Ministry of Agriculture, in the area of cooperative policy, to revitalize cooperative. I think this is a move in the right direction, Madam Speaker. Cooperative is very important in our society. Those of us who witnessed First Republic, we see how much cooperatives succeed in this country. So I think by thinking of bringing it again with a policy, I think it's a move in the right direction. Madam Speaker, with the support of the National Assembly, especially the Select Committee on Agriculture, an extra $100 million to agriculture. Yes, I'm happy that this thing has been captured so that at least the other institutions in the country can also try to approach National Assembly committees, lobby National Assembly committees in order for them to get some funds, because this will certainly take agriculture a very long way. Madam Speaker, going on to fisheries, water resources, Madam Speaker, really, I've gone through the report, page 35. Madam Speaker, the revenue aspect has been indicated. An employment aspect also has been indicated in the report. And then the fourth one is the water sector. Madam Speaker, I am impressed with the report that is before us today. 5 schools were provided with water. 5 health centers were also provided. 27 solar power water supply systems to various regions. 47 communities were also provided with water, with a number population of 50,000 inhabitants. I think this report, as far as I'm concerned, the Ministry of Water Resources has done a good job, and then the report they sent to the Office of the President, I don't see it, I don't know, but I think it's well captured. Coming on to basic and secondary education, Madam Speaker, I think the minister needs commendation with the Gambia MRC Holland Foundation. Madam Speaker, sometime last week, or this week rather, I saw the minister and the coordinator of MRC Holland Foundation in most parts of the country for an inspection to see what to do with the schools before the time comes. I think that was a good idea, really. Coming on to health, Honorable Speaker, the Minister of Health and the team and all those lieutenants who joined them in the various security service, and of course, and individuals who joined them to fight for this COVID-19 deserve commendation. I commend the minister and his team, and I will not stop there, Madam Speaker. I heard it over the radio and the television that Esau Health Center has been now transformed to a district hospital. I think this is a way in the best interest of the people. And I think with this COVID, we don't pray to Allah because it's a pandemic that covers the whole world. But Madam Speaker, with this COVID, really I think we had an opportunity to make sure that some of our facilities, health facilities, to be improved. The fund that came should have concentrated in most of our health facilities. After having said that, Madam Speaker, I went to justice. In the report, I think it's only justice that has complied with the reform standard for this government. The government is a transitional government, and it needs to do a lot of reform. But in the judiciary, I see that there are reforms. TRRC has been instituted, and Gambia government appoint additional judges during the period under review to Gambianize judiciary. That also is a part of reform. At least, judiciary has done their part, as far as I'm concerned. Madam Speaker, on the side of petroleum, Madam Speaker, I want a clarity on this drilling, because are they going to drill the petrol itself, or are they going to drill to make a research, to find out whether we have a petrol in our country? I want a clarity from the minister. Madam Speaker, having said that, sorry, the report should have featured the challenges facing our ministries. But Madam Speaker, this has not been featured. I'm sorry. This has not been featured in the report. And it is true, the challenges featured in the report that National Assembly can work on. So I see no reason why challenges has not featured in the report. Some achievements has been featured, but the challenges, which of course is very important, has not been featured in the report. Honorable Speaker, with these few remarks, this is my observation and this is my contribution. And I think since the President has fulfilled its constitutional duties, I think the report needs to be more than this. The report needs to be more than this, because this is a very important report about his policy, his government policy, and the administration of the state for the whole year the report should be bulky and more than this, so that will help the National Assembly to do their scrutiny job. I thank you.
Thank you very much. Honorable members, I have exhausted my list of honorable members who wish to make their interventions. I think I have called almost everybody who indicated his or her wish to say something. But at this point in time, the next step is to call on the Honorable Minister to respond to the issues and for the Her Excellency the Vice President to wrap up. But I think this is a convenient point for us to take a short break. Some of us have been sitting since 10:30. So we take a short break for lunch and then we come back at 3:30 and hopefully proceed also with the adjournment debate so that we'll be able to finish up everything today. So I think let's bear that in mind so that we'll come back on time. So I will suspend the sitting till 3:30 and the sitting is hereby suspended until 3:30. Thank you very much.